Good morning, everybody. We're gonna get started here. It's February already. It's going by fast. So we're here today at the Animal Humane Shelter. Believe it or not, this was my very first location meeting back in 2018. So feels good to be back here. And at that time, Dr. Graham Brayshaw, which you'll meet in a minute, was on the board. So it's good to see familiar faces here. Go around and start with introductions before we get started. I'm Erica Sawatzke, turkey producer and member of the board.
Dr. Peggy Ann Hawkins, livestock veterinary from Northfield, Minnesota.
Melissa Smith, business manager for the board. Mackenzie Reberg, USDA at E. Carissa Allen, with the board, I'm the database manager.
Lucy Hunt, Minnesota Department of Agriculture Emergency Programs.
Shauna Voss, assistant director, board of animal health. Kate Rail, senior veterinarian, bovine traceability and livestock concentration programs at Board of Animal Health.
Hi, good morning. Stacy Holzbauer, public health veterinarian at the Minnesota Department of Health.
And Callahan, communication specialist at the board.
Graham Brayshaw, Chief Medical Officer, Animal Humane Society.
Paul Anderson, veterinarian, and I'm chairman of the MBMA Small Animal Welfare Committee.
Elaine Hanson, Minnesota Pet Breeders Association.
I'm Steve Kivisto, Senior Veterinarian Companion Animals at Board of Animal Health.
Allie Dahlheimer, I am the companion animal field veterinarian.
Michael Crusan, communications director at the board.
Eric Job, assistant director of the board.
Michelle Medina, I serve as Director of Relations for the board.
Brian Hayes, Executive Director for the Board of Animal Health and Minnesota State Veterinary.
Brandon Schaefer, member of the board and a beef and swine producer.
Alex Stady, board member and member of the Shockley and Sioux Committee.
Do we have Dr. Fox online that she can introduce herself?
She said she was having trouble hearing us.
Okay. Do we have Steve?
She's gonna log back in, sorry.
Okay.
What was the?
Do we have board member Steve Neal online? He was maybe going to be a few minutes late. So,
Okay.
okay.
It sounds like he's having connection issues as well.
Yeah.
Yeah.
Yeah, yes. Okay. We do have 3 board members that I think will be joining virtually. So maybe when they jump on, just let me know and we can have them introduce ourselves. So we'll get started and let Dr.
If it's our fault, let me know and I'll grab Jay, who knows what's going on. Thank everyone for coming. It is wonderful to see Erica for many years on the meeting side of it since Erica was here. So before I'm Dr. Graham Brayshaw, Chief Medical Officer at Animal Humane Society. It's our second time to host now. We're always happy to host for Board of Animal Health. It's not just because I believe we might actually be inspected today too, if I remember correctly. One stuff to get taken care of, which is great. For those who just arrived, bathrooms out these doors, they stay open. Turn right, head down the hallway. You'll see bathrooms on that side of it. Conveniently, puppies are just on the other side of the glass wall. Adoption opens at noon. Just put that out there. History of organization, generic name, Animal Humane Society, but we're the local shelter, and then we started getting some clinic work as well. We go back to, I think, 1878 is like initial, we were here for horses and kids. Have evolved since then of mostly focus on dogs, cats, small and fluffies that we can adopt. Looking at the organization itself, we were the merger of Humane Society for Companion Animals, which is with the Woodbury and St. Paul shelters, with the big shelter here in Golden Valley. Coon Rapids was Animal Humane Society, and the Greater West Metro out in Buffalo. So those 5 groups actually post Katrina response, realized we could do a lot if we really work together on that side of it. So that's where we have no national affiliation on it. It is simply Board of Animal Health oversight, but we're pretty much a private 501c3 on that side with a board of directors that actually has a meeting in this room at 5 o'clock today. So it's a day of board meetings on that side of it. Where we're going, sheltering has improved over years, and it's really access to vet care. We've got For anyone that wants to stick around afterwards, we'll do a quick tour and I'll make it as quick as we can, but we're about an 80,000 square foot building. But we're looking at expanding, especially our veterinary care footprint on that side. So we're for the Board of Vet on that end, but just wanted to give a little history. This building itself, I think the cornerstone over there says 1967. So this place is a little bit of an old bunker on it. Definitely needs some updates. But hopefully it does a good job hosting y'all today. And any animal up on this floor is available for adoption, just to reiterate. But thank you all for coming in. I really appreciate it.
Thank you. Yeah, the tour, when I was here last time, the tour was really interesting. Just to see, you know, all of the animals that come in, even from out of state, I mean, the movements and the animals that go out. So if you can stick around for the tour, do it because it was really kind of enlightening. So I check in with our tech team. Do we have any of our other board members yet?
Not yet.
Okay, no, that's okay. So I think that we will go ahead and I'll ask if there's a motion to approve our minutes from our December meetings.
I so move.
There's been a motion. Is there a second?
I'll second it.
Okay. Sorry. Any discussion? Any discussion? All in favor, say aye. Aye. Opposed, same sign. Motion carries. Okay, is there a motion to approve our agenda for today?
Oh,
There's been a motion to approve. Is there a second?
I'll second.
Second, is there any discussion? Any discussion? All in favor, say aye.
Aye.
No discussion. Sorry, motion carries. Motion carries. I'm sorry, I was up with a sick kid in the middle of the night, so my brain is only half functioning today. All right, Brian, it looks like you're up next on the agenda.
There's a printer here if you want that.
It's all good. Right.
Perfect. All right, I don't know where it's at. I was also up with a sick kid all night and a sick horse, Erica, so.
So, good luck.
Not big now. Priority, so, just kind of going through the things that are on our plate. This is a grand list, not everything, not fully encompassing, but these are kind of the things that keep us busy at the board. Highly pathogenic avian influenza. Dr. Voss will talk a little bit more about that later on. H5N1 and livestock is still kind of a situation where we're paying attention to. Avian metapneumovirus. Dr. Voss will also touch on that. New World screwworm, tick, swine, companion. It's really funny. We're busy all the time. So. Just to touch really briefly on IPAT, because Dr. Voss will talk about our local response. I just wanted to mention kind of some interesting things that are happening at the national level. We've got the Poultry Innovation Grand Challenge that was awarded last fall. 100 million in funds were appropriated for this from the Secretary of Agriculture. Things that they wanted to really dive into were development of novel vaccines for IPAP, development of novel therapeutics, and research for improved response activities. Of that 100 million, they had $800 million in applicants for projects. So 100 million were granted, and I'm proud to say 6 of those went to Minnesota recipients. So 5, the University of Minnesota, and I think a couple of those were actually related to novel vaccine development, which is great. We're hopeful that we'll get to the point where we can actually have a usable vaccine for this virus, and we can approach our approach to dealing with it a little more scientifically, a little a little more current. And then one went to the Minnesota Turkey Research and Promotion Council that is dealing a little bit more with improved response activities and some of that. So excited to see where those projects go. And I believe, Shauna, do you know if they start those this summer?
You know, the MTGA got their money, so they could start.
So, okay.
Now.
And Hemant, the same thing at the U?
Yeah, it's, I think before May, they had to start spending the funds is what we were told. So
So this is-
March, yeah. And by end of spring.
Perfect. So more to come on that. Real quick on H5N1 situation. So we're happy to say that Minnesota is still in the category 4 of the National Milk Testing Strategy category. So that means we haven't had a detection in any of our milk samples in over 4 months. Actually, I think it was last spring that we had our last detection, that peculiar case of a individual cow in a dairy herd that was positive. So continuing to be part of the testing program as required, but we've changed our approach to milk silo testing. So instead of doing the monthly testing from the herds with collaboration with the MDA and their laboratories that are testing milk already, we've shifted to the milk silo testing, which is more under the guise and authority of USDA. The strains that we've seen this year, so that B313 was what we call the dairy strain. That was the one that was really affecting dairy cattle and our poultry. That really has kind of waxed and waned. There's a couple of pockets in California, and I think Idaho might still be festering a little bit with some cows that actually they brought in from California, but we really haven't seen the B313 strain in most of the dairy cases that are reported in the US. However, the D1.1 strain has popped up. So the D1.1 strain of avian influenza is the one circulating in wildlife, wild birds. We kind of knew this was what was coming. It's what we've seen in our poultry cases for the most part, but there have been a couple of there've been a handful of cases that have been attributed to that strain in dairy cattle as well. A little bit different. It's not spreading from cow to cow. That's a individual introduction from wild birds. So the suggestion is it's just developed more mammalian adaptability. So it's able to infect those cattle a little more directly. But it doesn't seem to be transmitting as readily. And then maybe it's because we're keeping closer tabs on it. The closest case of that was in Wisconsin, actually. So Wisconsin had their first and only case in a dairy cow this fall, and it was the D1.1 strain and kind of a one and done. They haven't had any more cases, but knock on wood, still nothing to report from Minnesota. We continue to be part of the testing, but more of a regional testing through that milk silo testing. And then my last bullet point is that the USDA order on pre-movement testing still is in place. So nothing's been resolved or removed because we've reached category 4. Cattle, lactating dairy cattle still have to be tested prior to interstate movement. New World Screwworm. The new headline for us. So it hasn't surpassed high-path avian influenza, but this is really one of the main topics we have at the national level when I'm in meetings with other state veterinarians and with our national USDA folks. So New World Screwworm still hasn't reached the US border. We're still free of New World Screwworm. However, we're starting to see more cases in Mexico. Tamaulipas is the state just, you can see kind of the green tealish color there. That's the state just south of Texas, or borders Texas. And that's where a majority of the cases that we are hearing about recently are coming from. I think it says on there 20 total cases, of which 8 are still active. It's weird. I've been seeing like 3 new cases and then another day 3 new cases, and they're all kind of in that area. The concerning part on this is these are not attributed to movement. So up to this point, we've been hearing these are cattle that were smuggled from South or Central America and probably brought the parasite with it. But the cases that we've been hearing for the last month have all been non-movement related. So this is suggesting or pointing out that the fly is resident in those areas now. So we're actually dealing with a complete life cycle, and it's able to replicate or infest and continue to move. Concerning because we're in the middle of winter and in my mind, it feels like there's almost an army of New World screwworm kind of starting to build up and just ready to head north when the weather allows. I've heard some reports that the snow and cold spell that we had here over the last month really did a good job of keeping it at bay, but that's lifting soon enough. Governor of Texas recently declared a state of emergency in Texas because of this, not because it's there, but because he's pretty concerned that it will be there. So efforts to release sterile flies have shifted. So primarily that region in Tamaulipas that was showing these infections was kind of the area that these dispersal programs were going on. They have now moved those into Texas as well. So we're actually starting to release sterile flies in the US to help keep those at bay. So some good news in the attack on this parasite is the FDA has approved some emergency treatment. So we had off-label use for certain pharmaceuticals, but the USDA has fast-tracked a couple of those to be labeled uses. So Dectomax and Exalt in cattle. So dewormers that we already use are now labeled and we can say are effective against New World screwworm, and then Credelio in dogs and cats. So I'm really excited about that one because, and I was just talking to Graham about this earlier. One of the big concerns that we're seeing or hearing from our counterparts in Mexico is the feral dog situation down there is hard to control. They don't really deal with that much. So they've got a real wild dog problem down there, and those dogs are part of what keeps the New World screwworm life cycle going. So a lot of puppies, a lot of opportunity for fresh wounds and things for the worms to take hold of. So I'm excited about it because we've got a treatment for that. If we get to the point where that's a big concern, big incursion into the US, into Minnesota. So I said this from the beginning. I don't think New World screwworm is going to show up in abundance in cattle or livestock. I think if we see it in Minnesota, it's going to show up on companion animal, either someone who's traveling with their pet or animal that's brought back by a rescue group. So some opportunities to maybe nip that before it gets here. And so that brings me to my last bullet point. The USDA has recently announced a New World Screwworm Grant Challenge, similar to the High Path Grant Challenge. This is $100 million in funds. The areas that they are looking at projects on are enhanced sterile fly production, development of novel traps and lures to determine where these flies are, developing increased understanding of the therapeutics and treatments, and then developing other tools for preparedness. So when this grand challenge came out, I don't think it was probably identified as something Minnesota would apply for, but I'm actually thinking we should. So I think there's some opportunities. We're probably not going to get involved in the production of sterile flies up here, but I think we can be involved in those last two bullet points, talking about therapeutics and treatments, as well as bolstering our preparedness. So is there a way that we can work with our community of small animal veterinarians to get the word out to their clients and patients that might be traveling to these areas, as well as our rescue groups, humane societies that might be bringing animals up from those countries, or even just from our southern states, because I anticipate this will land on our border and into Texas by the summer. I think it's just moving that direction. So I think there's opportunities to collaborate on some ideas there. I also talked to Dr. Holzbauer, and she came up with another brilliant idea. So working on the companion animal side and making sure we're getting some information out about that, but also reminding us that we have a lot of migrant workers on our poultry farms and our dairy farms that potentially are coming from these areas. And is there an opportunity to get education and information to them as well? Because people carry this too. So are we able to work with some of our industry folks to make sure our people are staying safe and are aware of what they can do to help prevent the spread? So great opportunities. I've got all kinds of ideas, but I'm going to rely on everyone else to help me here. So more to come on New World Screwworm. Other things I just want to point out as we get into warmer weather, ticks. We've got some nasty ticks that have decided the US is a good place to set up residence. Asian longhorn tick is one we've kind of been hearing about. Obviously, the East Coast has been where it's seen primarily, but it's shifting this way. We're getting more reports every year about it moving west and even a little more northward. So that one, and then the Lone Star tick. We're getting more reports of this moving northward. So actually, in Wisconsin last year, I think it was, we had 1 or 2 human cases of this, and this map shows, you know, where it's been designated as it's probably established. So there's a little pocket in, I think that's Dane County in Wisconsin, that has potentially an established population. This is that one that if a person gets bit, you develop an allergy to red meat. So that's a nasty one. Anyway, keeping tabs on that, paying attention to where those are going. Swine program, just a quick update on this. The US SHIP has been codified as a USDA program now. So similar to NPIP, that is in control and under the administration of the USDA. I'm happy about this. And actually, Dr. Voss and I were talking yesterday about kind of the differences between NPIP and US SHIP on how they were developed. And NPIP was developed for domestic diseases in poultry and how we eradicate those, and not really for foreign animal diseases. So NPIP isn't there to address high path. It's there to address low path and other things. US SHIP went the other direction. We started looking at foreign animal diseases. It was designed around African swine fever, something we don't have. But this year at our House of Delegates meeting, I was happy to see, and it was actually the Minnesota delegation that brought forth some ideas to pursue more domestic diseases. Make this a program that's usable today, not when when ASF gets here, but in some of the diseases that we have now. So PED, Mycoplasma were a couple of them. I think PRRS is probably coming down the pipe too on diseases that we're going to try to determine how can we establish some kind of control, maybe even eradication. So some neat things coming out of US SHIP that we're expecting this year. African swine fever, always kind of in the rearview mirror, but it feels like it keeps getting closer. Still, closest cases would be in the Dominican Republic and Haiti, but wild boar cases in Europe have been kind of skyrocketing too. And in particular, Spain recently has had a lot of cases of African swine fever in their wild boar population. Again, it's a cultural thing. So wild boar hunting is a thing you do in Europe. That's just heritage. So it's hard to eradicate this disease if you don't eradicate the source of it. My plea to people that travel to Europe is don't bring anything back. So enjoy the food there. Don't bring it back. I think even Lucy was in Italy, and I said no food comes home with you. But a couple of projects going on. So I Protect Pigs is a photo contest that the USDA has put on. So you send in your picture of you with a pig, and it kind of comes part of their brochure, their marketing campaign to identify potential sources of African swine fever and feral pigs. And then in Minnesota, the DNR is starting a Squeal on Pigs Minnesota campaign. So DNR is in charge of loose pigs, and they work with us to try to determine where those pigs are coming from. But Eric Nelson has started a program. He's kind of adopted it from, I think, Manitoba was the first ones to come up with this. So it's basically a phone number to call. If you see pigs that aren't where they should be, call this number, and the correct officials will hunt them down. So that's still in the works. I think he thought that would get approved by the end of February and maybe be up and running by March. So more to come on that. Foot and mouth disease, I just wanted to mention again that we were selected as one of the states to participate in a pilot program or an exercise on foot and mouth disease vaccine dispersal. So it's happening this summer. I forget, Lucy, July is when that happens.
Sorry, what?
The FMD exercise, is that in July?
Late June.
Late June. So, and we're participating, I forget, it's in Nebraska, Kansas, and us.
Kansas, Ohio, and us. Yeah.
So,
Iowa, sorry.
Yeah. So the plan is, one of these states is going to have FMD theoretically, and we're actually going to go through the steps of how do we apply a vaccine program? What are we going to do? How are we going to request the vaccine? How is it getting delivered? We're actually working with the VDL to store the vaccine when it comes here. So it will be a legitimate placebo. So we're actually getting something that will then be dispersed to a farm, injected in pigs, and kind of going through all the motions. So we're excited about that. It'll be kind of an intense, I think it's a week-long project when it actually starts, that whole.
It's like a month.
Oh, yeah. So we've got a lot coming on foot and mouth disease, but something we don't have a specific vaccine program for Minnesota yet. So this is going to help us develop that and probably piggyback a little bit off of some other states. Companion animal programs. Just real quick, 99 kennels and 79 commercial breeders that are inspected by the board. Diseases that Dr. Kivisto and crew have been working on this year. Tularemia has had a huge year. Brucellosis, 3 positive cases. Rabies cases still continue. 36 bats, 3 skunks, 2 cats. No H5N1 reported in any of our domestic species this year. My last bullet point is welfare case assistance. So this is something that comes up frequently. We hear about this, especially during legislative session when CAD bill gets presented and people question what we're doing about animal welfare, and it's kind of a gray zone. We have limited jurisdiction over animal welfare cases, but I want to point out that doesn't mean we aren't involved. So Dr. Kivisto and team work very closely with various groups. If there's a welfare case that is brought to our attention, we determine what our jurisdiction is, and we do try to be involved. We do have some situations where we're actively involved, other situations where we're able to provide some information to them. So just a reminder that we do get involved in welfare cases as well. Traceability. Dr. Cornel and her team have been busy with a couple of new things rolling out this year or since last year. So on the right side, the requirement for the RFID tags is still a thing. We're getting those free tags out as we get them, but there's a limited number of allocations. So we get a lot of complaints about why don't we have any more free tags. So just some growing pains in that program. The other program that is just starting is our transition to electronic CVIs or health certificates. So this is something that actually for export started January 1st. All animals exported from Minnesota are required to have an electronic CVI, and in July, we are going to start requiring it for import. So this really streamlines our traceability. It actually makes our staff much more efficient in the job versus taking a paper CVI, scanning it, and then entering information. So this was actually brought up at the USHA convention last fall, and we have other states that are adopting the same thing now. So Dr. Cornel kind of spearheaded this, and as you can imagine, everyone thought it was a good idea, but they're waiting for someone else to start. But we have, where'd Katie go? How many states are doing this already?
A lot of states prior to us were requiring for export CVIs, but now there are a couple that have, at least Texas and Ohio, that have it.
Yeah.
Timeline for changing for imports as well.
So they're jumping on the bandwagon, and I think this is just kind of a natural transition. Everything is electronic these days, and we do have options for people that don't have access to it. If they are subscribing to some platform that provides that, we do have some options for them to obtain the electronic CVIs. Wait. Oh, my last slide. Non-disease challenges. And really lately, the challenges have been with the federal administration and our interaction with the USDA. And I always want to apologize right away to our local USDA because this does not apply to them. Our local USDA has been with us lockstep and partners all along, and I think they feel some of these same frustrations. But at the national level, changes in philosophy, priorities, staffing, communication, and policies have really kept us on our toes. So changes, and some good, some bad. So this is where the grand challenge for High Path came out of. That was a plan to do things differently, which I think we agreed with. But along with that came some other auditing formats. So you've heard Dr. Voss talk about BCAP audits and BIFA audits and audit. And it feels like a lot of these programs have been released without fully vetting them. So we're getting a lot of confusion in the industry locally, and then we have changes in administration at the top where some people aren't sure what the program was. They maybe weren't there. So there's growing pains, I suppose, but it's been frustrating. Recently, earlier this month, we also, for a week, were wrapped up into kind of a political fray with the Secretary of Agriculture suspending all USDA funds to the state of Minnesota. So that was confusing. No one knew what that meant. No one told us what that meant. I saw it on the news. So I reached out to Commissioner Peterson. He found out the same way I did. So, I mean, there was a letter sent to the governor, but nothing really sent to the agencies that need or use this money. So just a reminder, between a quarter and a third of our funds, our budget comes from USDA cooperative agreements. So it was a lot of panic for us at the board, trying to figure out what does this mean. We were getting different stories. No, that doesn't affect you. That's just SNAP funding. We contacted our people that we send our invoices to, and they said that does affect you. All 8 of your cooperative agreement funds are suspended until further notice. So I contacted the chief veterinary officer that I would contact for this typically, and I got an email back that said I retired today. So fortunately, she still had her computer, and she emailed right after that, said, I'm still here, Brian. I'm not here on Monday, but here's who you contact. But so she passed me on to the assistant deputy administrator, and he also found out the same way I did on the news. So even internally, there's not a lot of communication. So it's frustrating to try to understand what to do. And we had a lot of intense meetings about what does this look like. Of course, that's when we had a flash of IPAP cases too. So who's paying for that? How do we approach depopulation? Is indemnity affected? So a lot of questions and not a lot of answers. We used to be able to reach out to someone and get an answer on the spot or within the day, but it took a week before we got a response back that said, your funds have been restored. You're free to start spending again. So a breather, but it really makes us nervous. So Melissa and I have a lot of conversations about what does this do to our budgets, or what do we need to be aware of down the road? Because our budget is pretty thin already as far as margins. We don't have much left over at the end of the year because we're using every last bit, and that includes the increase in appropriations for last year. So we'll get a little more bump this year, but still, inflation affects everyone and everything costs more. And if you remember, about this time last year, we also had a similar situation where our funding was kind of questioned. So it wasn't suspended, but it would be our upcoming cooperative agreements hadn't been processed. So we actually had to cancel some contracts for about a month, which was not fun to do, but just something that I think is probably more serious and something we have to pay closer attention to, where our funding and our budget comes from and how that looks down the road. I think we need to at some point sit down and kind of figure out what's our emergency plan if we get to a point where these funds aren't available or something happens. Again, this administration is different. They make orders kind of at the drop of a hat, and we have to move on those pretty quickly. So we feel safe right now. We feel like things are stable, but I think this will be an interesting year just to see how those things go. Again, our local USDA are great. We love and support our local USDA, and they're feeling the same crunch that we are. But just some things that are heavy when we are trying to manage the program. And I think that's my last slide. Any questions?
Questions for Brian?
Thank you for what you and your staff are doing
Mostly the staff.
with all the angst and anxiety sometimes that comes in on some of those things. Thank you, guys.
And I hope your kid and your horse are recovering.
Watching my phone.
All right. It sounds like I think we have Steve that has joined online, our board member. Steve, are you able to unmute yourself and introduce yourself.
Can you hear me?
We can hear you, Steve.
Okay. Steve Neal, member of the board, beef producer from Northfield.
Thank you. Okay, Dr. Fox, are you able to introduce yourself as well?
Yeah, Dr. Jessica Fox, board member, veterinarian, mixed animal practice in Southwest Minnesota.
Thank you. We don't have Dr. Abby. Okay. Looks like Michelle, you are up next.
Okay, good morning, everyone. I'm Michelle Medina. I serve as Director of Government Relations here for the Board of Animal Health and the Department of Ag, which is kind of a good fit. We have a lot going on, as you know. So just quick legislative update. Session starts in just under 2 weeks. We're going to start on Tuesday, February 17th. That's our first day of session. And then session has to end by May 18th of this year. So the Agriculture Committee has the jurisdiction for the Board of Animal Health. That's where your budget and policy, all that lives with the Agriculture Committee. So this year, same schedule as last year. We're in the second year of the biennium. So the first year was 2025. Now we're in 2026. So that's our biennium. We're going to meet for the House Ag on Monday and Wednesday from 1 to 2:45 in Capital G3. Same time and place. Same for the Senate. We're going to meet also on Monday, Wednesday from 3 to 5 p.m. in the Minnesota Senate Building, room 1150. So we will go to the House and then to the Senate, do all of our committees kind of the same day. So I'm expecting that we'll have pretty early presentations in committee, still working with the committee administrators to figure out when we're going to present in committee and kind of the topics they want us to present on. I'm assuming some of the things are going to be a lot of diseases, will be a lot of questions on that. So also high path, both in poultry and dairy. And they kind of want some information about the strains. Why are some strains affecting dairy cattle and not others, or poultry, you know, how are those strains kind of spreading across the nation and kind of the world, because we know that this is across the whole world, as well as New World Screwworm, ASF. I'm sure that's about our federal funding, which is also pretty big for our agency. I expect some companion animals to come up. And then if there's any other emerging topics, the board has any other diseases we're kind of watching or different things. And then I would say we'll probably touch on fraud. I think for the board, you know, we have a very small budget. We don't do grants, we don't do those programs, but I think fraud will kind of be the overarching theme of this session. So just a reminder of how each of the bodies are made up. So in the House, we have a split between Republicans and Democrats. So we're 67-67. So each committee has co-chairs. So usually you have a chair and then a minority lead, but we have 2 co-chairs from each party. So it's a split jurisdiction, I would say, kind of split leadership. And so every other day they will trade off who has the gavel and who decides the agenda. So we'll switch again, just like last session. In the Senate, there's a 1-seat majority in the DFL. And so Senator Eric Putnam is the chair. And so he will set the agendas in that. He also works quite well with his minority lead, which is Senator Tori Westrom. And so we have a pretty good committee over there in the Senate. So that's kind of how those will work out. We'll have a new member in the Senate committee as well. Senator Paul Anderson passed away this summer. And so his position will be replacing that committee to bring back to the even numbers in the Senate. So we'll have someone new there. And then all the special elections have happened as well. So now we're back to our full capacity. We have all of our legislators back until November. And that's for later. So just a reminder, again, we're in the second year of the biennium. This is primarily a policy year. So that's where the focus will be. Last year, I believe, according to my count, there were 6,896 bills introduced. All of those bills are still in play this session. So those all come back. So there's all those bills plus all the new ones that are going to be introduced. So it'll be a lot of bills to track throughout all of the committees. The session, that's a lot of bills to watch. So we'll kind of see those. I need to kind of go through again the bills and just track which ones are relevant for the board.
As you're looking for that.
Yeah.
I think you mentioned Paul Anderson, but I think you meant Bruce Anderson.
Sorry, correct. Yes, Bruce Anderson. Yes, sorry, Bruce Anderson.
For a public meeting, I just wanted to.
Yes, no, thank you. I appreciate that. Yes. So I'll talk more about the bills kind of next session that we're watching, and we'll see what come of interest, what are going to be heard in committee, what gets introduced the first couple of days. I will say they already are drafting bills. I've already seen some bills come through, so there is work on that. So it's primarily policy year. There'll also be some bonding. So bonding is more so for capital improvement projects. The board doesn't have anything we do on bonding, so that's not super related to us. But that's gonna hopefully happen this year. It did not happen last year. There's also a possibility of supplemental budget. According to the November forecast in 2025, there's a $2.47 billion surplus for the 26-27 biennium. But then there's a $2.96 billion deficit in the 28-29 biennium. So I would say a lot of budgets are going to look at getting cuts in order to balance the budget into the tails, into that second biennium. So I think that's something we're going to be watching for. But you know, it's more of a policy year, but they can also do budget stuff. So we will see how that goes. There's also will be the February forecast will be coming out at the end of the month. So that'll also give us a better idea of what it looks like if taxes have been increased or kind of more, if more money is available, that could change also. We might not have to cut as much. We'll see. Again, the board's budget is very small. You're not going to balance the budget on the board. So I don't see our budget coming, but I see some of the bigger agencies will probably have to make some cuts, which is very hard in light of a lot of the federal cuts and pauses we've had. So any questions on this session? So then I just want to touch on to, you probably maybe have heard, there's elections coming up in November. So the main one being that Governor Walz has decided not to run for governor again for a third term. That has some kind of different consequences, I would say. So all of our commissioners the commissioners serve at the pleasure of the governor, and then I serve at the pleasure of the commissioner. So if we have a new governor, we could have new commissioners and all kind of new leadership in all the agencies come next January. So that's one thing to watch for. It's also kind of too, he's not running, and so he has maybe a little more flexibility to kind of go down the edge on things, maybe change things up because he doesn't have to run again. So we'll kind of see what happens. I'm hearing very different things for a session that we're gonna get a lot done, that we're not gonna get a lot done. There's gonna be a lot of infighting. There's gonna be a lot of grandstanding because there's so many positions to be opening up in November for elections. So there's a lot of retirements already too. There's already 22 retirements for in November. So we're going to lose 22 total legislators from both bodies. So those ones have to be replaced. And then there's also other legislators. There's 16 that are also running for other positions outside the legislature. So it'll be a lot of change as well. So for some of those legislators, again, that aren't running, it'll be a little bit different than those who have already decided to run again. So we'll kind of see some different dynamics there. And it's yet to be seen on how much gets done. It's really hard to say. There's a lot going on in politics these days. So it's just kind of a wait and see, but the board will be available. We'll be testifying. We'll be in committees. We'll be tracking all the different bills and available to answer questions and all of that presenting. I'm hoping we'll get an early hearing for the board, just kind of talk about what we're doing, what we're up to. Things we're watching, I think especially the funding issue is a big one. We have a lot of emerging diseases possibly kind of at our doorstep. So getting the chance to kind of explain what we're doing, how we're doing it, just the impact the board has across the state is really important. And then the impact with our partners as well. We couldn't do our work without the U of M, MDH, Department of Ag. You know, we're really a team. And so we just really appreciate those connections as well. So kind of explaining to how we all work together on our response is also important. Any questions?
I just have a question. Can you think of any big hot topic in agriculture that you think they're going to really struggle with this time?
Agriculture. I think funding. I think if they, the agriculture budget, so the board's budget isn't within the Department of Ag's budget. Our budget is less than 1/3 of 1% of the state's budget. So we're a very small budget. So again, you're not gonna balance the budget on us, but generally, if there's cuts, they go across all the agencies. So I think that, and then I think fraud, again, with the board, the fraud's not an issue. The Tarnaveg does do more grants, but we have very good systems in place, so we're not worried about the fraud on our side, but it's just, we're part of the governor's cabinet, and so we're just associated with all the fraud across the board kind of thing. So I think really there's gonna be a lot of fraud this session. And then maybe some immigration, I think also, which very pertinent to agriculture, as well as a lot of our workers immigrate to the country or are migrant workers and different things, or even H-2A and all of that.
Have we seen much activity on farms and things like that from the ice?
There's been
I
some.
don't know that you have the answer.
Yeah, I don't really have the answers on a lot of that. I know there has been some. I know they have gone to some of our larger processing companies and different things as well. So yes, there definitely has been some. There was a press conference a couple of weeks ago on that. Yeah, there's been some that it's kind of all across the state.
Any other questions for Michelle?
Yeah, can you remind us and therefore me, like at a time frame potentially for the companion animal audit?
So, no.
Okay. That's fair.
I thought we would have been audited by now, but I think they've really shifted their focus to the Department of Human Services auditing and with all the different fraud there. So I think we were on the docket sooner. I think we've been pushed back a little bit just because there's other priorities. I would assume that we should be audited this year. I can check with them too, if that would be helpful, but I would assume by the end of the year, we will be audited.
I was just wondering how long we have to behave for.
Yeah, I mean, keep behaving. Yeah, no, and
You know this is recorded, right?
I think audits can be hard, but I think also audits are very helpful for us to, again, review our system and our processes and ensure that we are doing things properly, or can we improve, right? Like, I think it's a good thing to do this deep dive into our program from an outside source who sees it very differently than we do. So I think it is a good opportunity for us to really showcase what we do, showcase our program and the great staff we have working on it. And then if we can improve, let's improve. I mean, there's nothing wrong with that.
Thank you.
Yeah.
Any other questions for Michelle? All right, thank you.
Thanks.
She's Michelle, you're due the end of April?
End of April, so I will not be here to end session with you all.
But will you be at our April 1st meeting?
Hopefully.
Maybe, we'll see, time will tell.
Yeah, time will tell. But yeah, so when I'm out, the commissioners will be finishing up session. So Commissioner Peterson, Commissioner Baldwin, Commissioner Chesed will be the ones kind of stepping in and finishing. If we need to finish a bill, I'm hoping we'll be done.
Yeah, thanks so much. Great, thank you.
Good morning, everyone. It's always a pleasure to be here in person, so I try to be when I can. And for those who don't know, I'm Hemant Naikare. I'm the media director. Next week, I'll be here 2 years in Minnesota. So getting to know the lab, getting to know the state. It's always a pleasure to work with all our state commodity group members as well as our legislative folks around. So blessed to be here. So for those who are attending the meeting for the first time, there might be anybody here in the room or online. Just very quick overview. We have 2 locations. We have in St. Paul, is the main location where the vet school is, and it's a full service laboratory. And then in Wilmer, 100 miles from here towards the west, is our poultry testing laboratory. So between these 2 laboratories, we serve all the 87 counties, and 75% of the work that we do comes from our state and 25% from our regional states, as well as some from overseas. Very busy lab. We do about 800 to 850,000 tests every year. Disease diagnostics, disease surveillance is the major part of it. But it is all shifting and shifting because of the way the funds are and the funding happens. So we are just trying to see how we can be diversified, how we can be more entrepreneurial, and piggybacking on Brian's last slide, non-disease challenges, they are more difficult to work with. Disease challenges, we are well equipped, but that's a big question we are all trying to work on. I'll pick the last slide where you ended was, with the communication on the USDA side. The good news is, this is official that I got an email from the USDA NAHLN that on January 2026, I was notified that the freeze on the NAHLN cooperative agreements with the university was officially rescinded. And that we are back in business as usual. That was a huge relief. It was only 48 to 72 hours when the panic happened, but we get $400,000 every year from the state. From the feds, from the USDA. $250,000 direct item because we are a level 1 lab, and the remaining $125,000 is variable depending upon how much money they have. But besides that, the reimbursements that we get through task orders can range from $300,000 to even up to $1 million. So those funds are vital for the lab to keep having the people at the lab to run the tests, right? So we are fortunate that that thing has been resolved. And that was all possible because of our folks in the room. Thank you, our board members, our poultry and livestock producers, and Commissioner Tom Peterson, Ashley Coles, and everyone over here, and our legislators. I'm mentioning about our legislators because we have one very good news that this thing was not impacted. This is a new competitive funding that we are getting from our senators. So Senator Smith, Senator Klobuchar. Through them, we were working on a marathon thing for almost a year and a half. And we were finally awarded $1 million in new funding, which will allow us to add new equipment to improve our LIMS systems, our lab information management system that allows us to, track diseases, communicate with the feds, with the state, with the producers. So we wanted 2.25 million, but we got 1 million. We'll work with that. But those were some good news. If nothing else, at least that's the brighter thing to start in January. Some key changes, and I was looking at in the last 1 year what happened. I'll update on these following items. On the equipment side, the VDL added a new tissue digester, and that will allow us to have a good carcass disposal system that takes care of all the carcasses at the lab, at the college, at the hospital, but also at times we help our producers who are in that region, they can bring in carcasses and we are able to dispose them safely. So that's one good addition. Then we were able to get a new MALDI-TOF mass spectrometry. Now that's a big name, but it has helped us to identify bacteria and respond to what kind of antibiotics can be used for treating those bacterial infections. We have this piece of equipment, we have 2 of them, but they were almost more than 10 years old, and the company doesn't support them anymore. So there was American Rescue Planning money, that was a funding that came after COVID, and that funding, finally, we were able to get those funds to buy a new MALDI-TOF. So that is going to be installed sometime this month. On the disease side, in the last 1 year, we have been busy with HiPath AI response on the cattle side, which was also also on poultry and wildlife, but we were doing a lot of surveillance, diagnostics, and research. Close to 190,000 tests of all kinds have been done since we have been monitoring this in FY23. So from July 1st, 2023 onwards till today, we have run over 190,000 tests, whether it is for disease diagnostics or surveillance. That shows the impact of a state VDL. Avian metapneumovirus, really a problem for our producers. I wish the feds considered it as a reportable disease and some situation by which testing gets reimbursed, because HiPath AI testing gets reimbursed, but avian metapneumovirus doesn't get reimbursed. And so there could be some situations where we are not doing testing, if it's not a commercial commercial folks will definitely do the testing, but if it is a smaller farmer and others, there are always hardships there, right? So some way, if we can get some funding for avian metapneumovirus, it's reportable in our state, but not at the USDA level. And then we have been busy with wildlife surveillance thanks to the LCCMR state funding, and that has also helped us to, look at not only wildlife surveillance, but also looking at for avian influenza and in general, what kind of diseases are there in the wildlife. So that was what we have been busy with. We started a new service called as surgical biopsies, which is really good for our companion animal folks. In the Twin Cities, we are surrounded by lots of cats and dogs. We have at least close to 1 million cats and dogs, to my estimate, because there are at least 60% households having one pet. So with that, having that kind of a service, we started that. That has also helped us bring in some revenue as well. On the personal side, in this last 1 year, we added 4 new faculty positions. Now, these are not new as in brand new. There's only one brand new. The others were replacement of people that have retired, and that helps us with succession planning. But we have new folks coming in with new ideas. The middle bullet here is that I want to make, and everybody knows this, but we do operate with a skeleton crew. When I'm saying skeleton crew, we need more people to do the response, because when it is to do with reportable disease, high consequential livestock pathogens, you want the testing to happen that day. Maybe if you send something in the morning, you want the results by afternoon. And we try to support that to the best of our ability, but that's a challenge. We are always working with a skeleton crew. So to address some of the workforce gaps, we were able to recruit through the CDC APHL funding. We have added 5 fellows, and that is helping us develop new tests. Because if we don't have people, we cannot bring in new tests online. So we are trying to offset some of that by adding people. But the biggest critical challenge for our sustainability is we will be compromising in providing timely responses to foreign animal diseases or economically significant diseases. From our assessment, we at least need 2 positions at our MPTL lab. That's the epicenter of poultry industry. Also, it's very close to the swine industry. And we need at least 4 positions. And these are people who are working, in the wet lab. They're doing the testing. They're working on the logistics side. I'm not talking about managerial aspect. This is like you need them on weekend testing and other stuff. So where will we find the money? Don't know. But we will definitely require an increase in state support. Our state support has been flat for more than 15 years. The VDL's budgets, 17% is all, that is $1 and $6 is what we are getting from federal and state together. The rest, we are finding funds from other sources. So we cannot cherry pick because we are the state's lab. We cannot do things that private labs would do, right? So therefore, more and more support needs to come to the state. And with that, what we do, these are just 3 bullets showing the impact of the work we do. We run at least 100 to 200 foreign animal disease investigations every year. In this federal fiscal year, FY26, actually not federal fiscal year, but it's the state fiscal year. That's an error on my end. We have already done 86 such investigations. To do these investigations, sometimes you only have to have 1 test you have to run, but there are 5 people involved. And then if you have to do it over a weekend, or if you have to do it after hours, the overtime and all. So the compensation that we get from the feds for some of these things is not going to help us sustain it in the long run. So I kind of categorize the opportunities and the risks. I'm more of an optimist person, so I'll go with the opportunities first. We are trying to improve on our collaborations with the college, collaborations with our clinics, and we are trying to diversify to get more and more research and contractual services at the lab, because we need to find some funds to keep things going, right? We are trying to expand our current services to new clients, looking at it from not just focusing on our core. Our core is there, very vital, the swine industry, the poultry industry, we are looking into that. But somewhere down the line, we have not been doing much on the cattle side. We want to generate more stuff for our ruminant folks to support them. So we're trying to work on that, find out more ways to innovate, develop new services for the protein market, for the pet market. And then that's where I'm talking about the cultural shift, trying to be more entrepreneurial, going out and seeking funds, trying to reduce the barriers for others to use the lab. On the risk side, is the cost of people, right? So what we were doing in the past, we were not filling the vacant positions, and you cannot go on that for too long. So when we hired 3.5, 4 new people, that adds cost. Plus the COVID funding that we had through the ARP, that is now, it's gone. So with that, we were able to hire some people for soft money positions. And now either we will have to lose those people or we will have to find ways to support funding for that. The increasing cost is at almost $1.2 million that we will have in our recurring budget for people and for some maintenance costs. Tariff, I put it out there because, we don't like to go up on our fees. We're very careful not to pass it on to a customer, but sometimes we have no choices. So we had a last fee hike in July 1st, or July 15th of 2024. We're going to push it as much as we can, but tariff is impacting us. Like the piece of equipment I mentioned, Molgaard, before the tariff situation, it was $20,000 cheaper. And then post-tariff, we had to pay $20,000 more. So we are seeing an impact on the costs. And the economic volatility is there, which, depending upon the market and how our exports are doing, so that impacts the submissions coming to the laboratory. So those are some of the risks that we are trying to work with. So we are trying to be more entrepreneurial. We are trying to be active at all levels. We are trying to be active at the research areas, like there is a conference for research workers in animal diseases. So we are out there to find out the new methods, new technologies. We are out there at the Minnesota Veterinary Medical Association, which was last week. We are out there at the Pork Congress next week. We will be doing, at the annual swine meeting, which is going to be end of the month. So, and then we kind of constantly have a monthly meeting within our group so that everybody can brainstorm. And we try to do certain things for our producers as well. So for instance, Swine Vet Center, which is a big clinic, and we will have them at the lab for a necropsy hands-on workshop that would be on March 20th. I'll very quickly go over, we are doing good in spite of all of this, we are doing good on the budgetary side. Just hoping to make sure time-wise, is it okay if I take another 3 minutes or I'm good? Okay. So this is a very busy chart. All I want to show here is these are the different sections within the lab. MPTL, we see it as a section, but in reality, it's a whole lab, and it really deserves more than being listed as a section. But for administrative purposes, that's how we're looking at it, because it's a full-fledged lab. We have 16 people there. And then the different other sections are molecular diagnostics, serology, other health, which is mastitis testing, which is the cow folks. All of these generate close to, the number of tests that we have been doing in the first 6 to 7 months. We have been doing close to 500,000 tests. So 500,000 tests have been done in the first 7 months, and then perhaps we'll end up doing 850,000 tests. 18% of our caseload, 9% of our caseload has increased. That has helped us to get some more revenue, but then that means we need to have more people. And the reason that caseload has increased is because of the 3 key drivers: the high-pathogenic bovine testing, poultry testing, even metapneumovirus testing. So those tests have helped us with our bottom line. We have been very active submitting new competitive grants. We're trying to take money wherever we can get. That's a different mindset, because in the past it used to be, we have service, money will come, we will get samples, that's all we have to do. Now I have to go out and search for more funds in different ways. That's what we are trying to do. So we've been very fortunate that we have 3 projects that are going to be at the lab. And these are to do with the vaccine, HPI vaccine development project. There is some part of it coming to the lab that we are working on with another faculty member on ag biosecurity. And then the VDL testing capacity grant, which is for the Wilmer laboratory, that will help us increase our capacity over there. So all those three things are possible because of the funding that we have received. Thank you, Ms. Erica, and then, all our swine producers and everybody else for helping us get that funding, because those letters of support were very vital for us to be competitive. At the same time, we are looking at notice for funding opportunities. That's a new terminology USDA is using. They used to call it RFA, RFPs in the past. So we are trying to keep looking at funding sources that are available from the feds and from Morris Animal Foundation and others. This slide shows what we are busy with high-path AYs, but whether it was for our state or whether we supported California, but in general, between the testing for research, surveillance and all, we ran over 200,000 tests were done in the last 2.5 years. And this is one last I want to show is like what we are doing on new test development. So at the recent MVMA meeting, at the small ruminants, we had a talk. We kind of educated our clients that the lab is going to offer a simple test as pregnancy test, and pregnancy ELISA test that will be really helpful for small ruminants, for cattle and other folks, especially in situations where a veterinarian cannot be at the farm, but if they can send us serum samples, we can run that test. And then on the small ruminant side, it's a small group. It's less than 2% of the nation's sheep population and the goat population, but it has a huge opportunity to grow. With the mutton goat industry growing up, with the goat milk industry growing up, that area is going to grow. So we are trying to offer tests as individual tests or panels for our folks, and that's what we have been busy with, trying to develop new tests and find more business. So that's all I had for today. I'm open to any questions, and thank you for your support.
Any questions?
Yes.
I'm just gonna say, I appreciate your enthusiasm and seeing this for the business that it is, but the service that it provides. So.
Thank you, Dr. Hawkins. Yeah, we're keeping an eye on like this New World a comment I would like to make about the New World Screwworm. So, we were trying to find out what can we do to be prepared. USDA did a publication in 25 years ago at the ARS lab. They came up with an ELISA that can be used because we have larvae of these flies. And if you're in the field, you do not know whether that larvae is from a regular maggot worm or is it from New World Screwworm. So to do that, you can do an ELISA test. But all of that is at the lab that somebody has to send it there. It's not commercially done. So an avenue for us to work together would be applying for funding to bring those lab tests, making them commercial, making them more lateral flow. That way, producers could run it to get an idea as to whether what kind of things they're dealing with, or at the borders, they could be able to do something. So the hope is that we can offer some testing that can be done in a couple of minutes to, so that you can know what kind of maggots you have if you see something. Otherwise, you have to take a picture, send it to an entomologist to confirm what it is. So that's just an example of what we're trying to do with the New World Screwworm. So,
Thank you.
I was to reiterate what Dr. Peggy had mentioned, that you and your staff and the responsiveness from a personal perspective, we use your services a lot. And we are one of those that ask for the rush requests and so forth, and their responsive and professionalism of your team. Greatly appreciated by industry, and I speak for myself and others that, yeah, it's well done, and I would say second to none in that regard, so.
Thank you, Mr. Shepherd. It is a very big teamwork, and most of the times those are after hours or it's a weekend thing and calling. We have called folks at 9 o'clock in the night to run a test because at 3 a.m. the truck is going to be, on the road. So getting those things out. So we try our best to support. Something out of the box thinking. We are surrounded by so many companies around here, and maybe we should look at it from a perspective of a fund that could be generated through our corporates in Minnesota and the Twin Cities. We have more than 25 Fortune 500 companies here. Maybe we should try to see other ways to have some emergency funding for animal health. And that I don't know the roadmap for it, but that is something which, we are hoping that we as a group can find some funds, because we just cannot rely only on state dollars or federal dollars.
Thank you.
Thank you.
Do we have Dr. Molgaard online?
Hi there, can you hear me?
We can hear you. Welcome.
Thank you. Well, Hemant shared the updates that are probably the most pertinent, so I'll be relatively brief here. There's been a lot going on since we last met. And again, Hemant updated you on much of that, but I'll just share a few other updates, and apologies. I am recovering from RSV. So I shared an update at the Minnesota Veterinary Medical Association. I did not share it because I was homesick, but I created an update that was shared by others at the MVMA annual meeting. And so I'll just touch on a few of the highlights, and there's a written report in your packet that includes some of it. A lot of what's been going on at the college has been around recruiting new faculty. We have seen record recruitment in the last year with 17 new faculty joining us. And people have asked why we've been so successful in recruiting in this time of critical faculty workforce shortage. And I don't have any clear answers for you, but when I've talked to the new team members, they've just said that they're so excited to join such an energetic, positive team with so much going on here. So we're thrilled to welcome new faculty. Some of them are pathologists, some of them are clinicians across the Veterinary Medical Center. We have continued we refer to it as our One Health clinic pilot, and that is funded by a philanthropic gift that allows us to work with the medical school and other health professional schools to put health professions learners together in under-resourced settings to provide care to pets and their people. So it's not completely different from our SERVs and Vet Touch student outreach clinics, but it is interprofessional, so that's exciting. There have been a lot of questions that I've received. I don't think from any of you directly, but around how is the university responding to the federal actions in the Twin Cities and the disruption that is causing in the Twin Cities and the protests that are causing disruption. At this point, the university has been communicating with faculty, staff, and students about what we know and how we're handling things. One thing that's important to note is there have been no verified reports of ICE agents on any of our campuses. There are a lot of questions about the possibility, but there have been no verified reports of ICE agents on campus. Of course, students, faculty, and staff live in various neighborhoods and are impacted more directly or more indirectly, depending on where they live. So the way that the university has responded to this so far, and again, this is a rapidly evolving situation, as you all know from watching the news, is that if individual students have specific circumstances, they can request accommodations to request accommodations. Whereas typically accommodations would be reserved for students with, for example, a disability or an illness. The university has extended that flexibility for other students temporarily, and we evaluate that on a week-by-week basis. There's been some confusion among veterinary students about what this means. So at the College of Veterinary Medicine, what it means is that we are able to be more flexible with our attendance policy for students who do have an accommodation. For lectures, they can watch those lectures that are recorded. They do still have to attend everything that's experiential, just because we don't have the option to put experiential things online. And then the additional confusion that has been, I think, voiced by our students and sometimes our faculty is that this is happening simultaneously with the year, the 2025-26 school year, where all veterinary schools had to change their modalities to limit the amount of distance education in the curriculum. So that's a requirement of the AVMA Council on Education, created originally by the US Department of Education, which certifies the AVMA COE. So we have less flexibility about how to do that than, for example, the College of Pharmacy, because we have a different accreditation standards. If this had happened, if the current disruption in the Twin Cities had happened 2 years from now, I don't think we would have had as much confusion from students, but the temporal proximity between the shift from our previous curriculum modalities to this year's curriculum modalities created, you know, again, specifically by accreditation and the student requests for more hybrid options have kind of collided in early 2026. So we are spending an inordinate amount of time answering questions about that, while also working with the rest of the university to understand the kind of evolving situation and responses. There is a lot of guidance available to anyone who's interested online under the university's website. And then there's specific intranet guidance for faculty and staff that requires logging in. So if anyone hears any questions about that, I will just ask that you direct those questions to me rather than trying to field them yourself, and know that if you're hearing something that sounds concerning, the university won't let us do what we want to do. There's probably something more behind that that prevents us from providing the flexibility that students wish we had. Our companion animal teaching clinic, which is in the old Pomeroy building, is now in kind of a soft launch period. And by way of reminder, that is a clinic, an experiential learning space, clinical learning space that was funded by a $5 million philanthropy gift from a foundation. That soft opening means that the facility is done and we have been granted occupancy, but we're starting with pets of faculty and staff before opening this up more to the public as we work out some of those kinks. But this provides just another wonderful opportunity for students to get hands-on learning. And then finally, we are continuing our planning for a new equine isolation, or I should say large animal isolation facility up at the Equine Center. That would be an approximately $20 million project. So that isn't something we can just flip a switch and do, but we are moving forward with the pre-design phase for that, which is desperately needed because we are still using, for anybody who went to the University of Minnesota and remembers the large animal isolation facility in the old large animal hospital, that is still what we're using. So we desperately need a new facility and will be proceeding with that. So lots of other things I could share with you. Strategic planning continues at the University of Minnesota, rolling out the implementation phases of the strategic planning, and perhaps most excitingly, reinvestment in the St. Paul campus. You might have heard about the St. Paul Student Center, which will be replacing the current library, McGraw Library, and the old Student Center, combining them into one modern facility that is desperately needed for anyone on the St. Paul campus, including students at the College of Veterinary Medicine, faculty and staff, and even clients, to be able to go get a cup of coffee while they're here waiting for their patient would be a big asset for us. And the location that they are planning, again, in the old McGraw Library, is very, very close to the veterinary school. It's it's attached to the Gordner Avenue ramp, essentially. So we are looking for letters of support from our partners. We asked the MVMA Government Affairs Committee about that. And by we, I mean my delegate, since I was not able to attend since I was sick. we talked to the MVMA about that, and they're going to be providing a letter of support. If the Board of Animal Health would be willing to provide a letter of support, it's just showing that in addition to all the other communities that the St. Paul campus serves, the St. Paul campus serves the College of Veterinary Medicine and its stakeholders. So happy to answer any questions about any of that.
Any questions for Dr. Molgaard? All right. Thank you for your
Thank
update.
you. Thanks very much.
Stacy's up next.
All right, good morning, and thank you so much for the opportunity to present to the board. I'll just give some quick updates from the Minnesota Department of Health Zoonotic Diseases Unit. So I'll first just give you all an update on the infant botulism outbreak that we've been working on. Talked a little bit about histoplasmosis, and then just end with some awareness and outreach events that we've been doing. So I had briefly talked about this the last time that we had gotten together, but luckily the fall and winter are kind of our slow season, but this has kept us busy, this infant botulism outbreak. And so just a quick review, infant botulism occurs when newborns essentially ingest Clostridium botulinum spores. So most people associate botulism with inappropriately canned goods. But what happens here is that these bacteria actually colonize the intestines of infants and then produce this toxin that is a neurotoxin. And so infants present with constipation and then other neurologic illnesses, including respiratory difficulty, and usually need to be hospitalized for extended periods of time. Any suspect cases need to be treated immediately with immunoglobulin, and the treatment actually begins before laboratory confirmation. And we actually, our lab uses a mouse bioassay. So we actually have colonies of mice at the health department that we're injecting with suspect isolates coming from stool samples. So it's a pretty intensive, very old school laboratory test, but it's all that we have available. So the response in Minnesota is multi-agency. So we work with our partners at the Department of Agriculture to investigate this outbreak. And so our epidemiology team, which is our group, provides guidance to clinicians, and we investigate cases. Our lab, the Department of Health's Public Health Lab, does the clinical testing, and we actually do it for the region. So we do essentially the entire upper Midwest. We're responsible for any testing any suspect cases. So we're also essentially clearing and approving any suspect cases that come from other states as well. And then our Department of Agriculture is assisting us with the recalls and doing the recall audits to make sure that this product is off the shelf. And so it has been associated with the By Heart powdered infant formula. And so we've had lots of recall notices, media, social media to raise awareness as well. And so at this point in time, this is the epi curve. And so there have been 51 suspects cases. Minnesota was actually the first case that was identified. And then as awareness got out, we've dramatically increased our testing. But FDA in their investigation couldn't confirm with the company that there wasn't any issues prior to this year. So they've gone back, and now we have cases going back all the way to 2023. So it's been a national outbreak. There are 51 suspected or confirmed cases from 19 states. We've had 3 cases here in Minnesota. All of these infants were hospitalized, but no deaths, fortunately, and their ages range from 16 to almost a year. And 43% of them are female. So California and Texas are over represented, but this is also our population centers too for the US. So we've tested product from our 3 Minnesota cases, including opened and sealed containers. We have results back for 2 of those cases, which were negative, and we still have testing pending with CDC on an open container. FDA and CDC have also been doing other testing nationally, and so far there's been 1 open container that has tested positive for botulism type A from a confirmed case in California, and then 2 samples, including 1 unopened container and 1 powdered milk sample that is essentially a precursor to the final product from the supplier, have also tested positive, and 6 product samples from By Heart themselves have also tested positive for type A. And so definitely an ongoing issue. The full recall is still in process, and FDA is still investigating with all of their manufacturing facilities and their suppliers as well. And on December 12th, FDA also sent out warning letters to several major retailers because they had not recalled the product. And I know our Department of Ag folks did several recalls and were able to find product on the shelves too in December too. So that investigation, so far we're not seeing any, we haven't had any additional cases in January. So we're hoping that the recall has stopped any human cases. So, but the FDA investigation will go on for a while. And then moving on to just a quick review of histoplasmosis. So histoplasmosis is a fungal infection that's caused by Histoplasma capsulatum. And its transmission is due to inhalation of fungal spores. And the reservoir is actually the soil, but most people associate it with cleaning up bat guano or bird droppings. And so incubation can be anywhere from a few days to a few weeks. And symptoms are pretty nonspecific, fever, cough, night sweats, and chills. And we see approximately 150 to 200 cases here in Minnesota each year, and they're mainly concentrated in kind of our agriculture and prairie areas. So like western Minnesota and southwest Minnesota and the southern tiers states. So kind of the opposite of our other major fungal infection of blastomycosis, which tends to be more in our wooded areas. And most people who are exposed don't necessarily get sick, but we do see a preponderance of men that are infected, usually because these are the folks that are doing construction or tearing things down where that may have animal infestations. And our median case age is 51, so older folks are more susceptible as well. So these occupational risks for histo include anyone who is essentially doing some type of construction or disturbing the soil. So workers, bridge inspectors are actually highly overrepresented, but construction workers, farmers and gardeners, anyone who's working on restoring old buildings, and spelunkers. So we've actually been part of several investigations recently of travelers to the Caribbean who are spelunking in caves. There is one cave in Costa Rica that has had multiple outbreaks. And there is also a major outbreak that's happening in Tennessee right now. And our pest control workers who are also working in these areas as well. And so NIOSH actually has an entire guidance document that if you suspect, say you're tearing down an old barn or something like that, where you suspect that there is either bat guano or massive amounts of bird droppings, full PPE, similar to what we recommend for HiPath AI. So N95 goggles and a hazmat suit and any gloves and boot coverings as well. And so it's really important for those folks that are doing these high risk activities, especially if you're immunocompromised, to take that appropriate protection. And there are professional companies that are available for hire to help clean up those areas as well. And so then just moving on to some of our recent awareness and outreach activities. So just to kind of give a very quick update on some of the other zoonotic diseases, we continue to assist the board and our colleagues on responding to H5. So we currently have 24 folks in monitoring. 3 of those did report illness. We are in the middle of respiratory season, so that's not surprising. 1 agreed for testing but was negative for H5. We did have 2 H5 wastewater detections from the Mankato water treatment plant around the New Year's holiday. But again, we can't determine the source of those, and there is the possibility for wild bird incursion in those wastewater samples. And we're working with the U of M Extension, who are doing backyard poultry workshops to help distribute some PPE kits, just to give our backyard poultry producers an idea of what type of PPE they should have available, because we continue to see that when we do have positive backyard poultry flocks, that they do not have PPE. We finished up our West Nile surveillance as well and had a record year of 129 human cases, including 14 deaths and 27 asymptomatic blood donors. So all people who donate blood in the US are tested for West Nile. And so we picked up 27 folks that were positive. And so then they are then notified of that infection. And then we had 2 rabies publications that came out, including a summary of the 2024 rabies outbreak in dairy steers. So many of the Board of Animal Health folks were also included on that. So thank you all for your help. But it highlighted the direct costs of this outbreak to the producer, which was over $3,500 in post-exposure prophylaxis, along with veterinary costs, but did not include the potential indirect costs of having to delay sale and being under quarantine. But we really wanted to get that information out there so that rabies vaccine is something that folks can think about, especially if they're in kind of our skunk highly endemic areas. And then we also had a publication highlighting our human rabies death from 2024, which was paired with a California case as well. And both of these situations, the individuals did have recognized bad exposures, but did not seek medical care or advice from public health, and unfortunately had exposures that we would have recommended a rabies post-exposure prophylaxis, and both of them succumbed to their infections. And then just ending with some of our outreach activities. So thank you all to those folks that attended our emerging issues gathering in December. We had 83 people from 34 different organizations, and it's just a great opportunity to see what folks are doing and the challenges that they're experiencing at the animal human health interface. And we are offering our agritourism workshop in March. So on March 26th at the Rosemont Library, and we're hoping to reach those people that have host agritourism activities, whether it's for profit or even just as part of a farm visit, just to talk about ways that we can hopefully prevent any potential transmission of diseases. And so if anyone's interested, please let me know, and we're happy to give you that information. And with that, I'm happy to take any questions that folks might have.
Right. Thank you.
Thanks.
It's okay.
Go ahead. Hi, everybody. I'm Mackenzie. It's been a while since I've been to a board meeting in person. I'm the USDA FE attempting to fill in for my boss Stefan today. I don't have any inspirational quotes for you. But we just have very few updates from USDA. Brian stole a lot of my thunder. But we have a lot of non-updates. There's a lot of things that we don't know about USDA right now. So hiring, we don't know a lot about hiring. We have many open positions across the US from people that have left the agency in the last year or so. They just sent out a recent hiring wave and Minnesota did not receive any of those positions. We are expected to get some of those positions in the future. Right now, they're really prioritizing New World Screwworm positions and then ADIC leadership positions across the US. So that's my non-update about hiring. And then New World Screwworm is really kind of the prime focus for USDA right now. That's where a lot of the positions that are going to be hired will be in Texas along the border, and that they're preparing to staff the Moore Air Force Base in Texas in preparation for dispersal and production of the sterile flies and diagnostics and things there. Luckily, I think Friday, the funding lapsed for some of the federal government, but luckily USDA was not affected by that. The USDA budget is set through September 30th. And then we get to find out what happens next. And then as usual, our high path response continues. It seems like that never ends. And now, just before lunch, I have a whole bunch of really great photos.
Yeah, it gets better.
It does get a little better.
It's not a bit fighters.
There we go. Okay. See, my warning contains graphic photos, so close your eyes if you get worried. Just a caveat, this is the cleared presentation, so it's not the most up-to-date. Brian shared some more up-to-date maps. I'll try to fill in where I can. But so these are screwworm flies, the adults. They're this nice shiny metallic greenish blue. They have orange eyes and 3 black stripes on their back. So if you see those, call somebody. Just a brief outline of what we're going to do today. I'll try to skip the things that you probably already kind of know about screwworm and kind of focus on what might be coming next for us. We'll just kind of talk through what screwworm is, how it replicates, what it looks like. That's the good part. Where things are now, and then what people can do in different areas of their life. So what is New World Screwworm? I spent like 5 minutes yesterday figuring out the exact way to pronounce Cochleomya omnivorax. So that is the fly that causes New World Screwworm. It is unique because it feeds on living tissue, not just dead tissue like a lot of our other kind of mega infestations are. The current outbreak is not in the US. It's been traveling northward through Central America and Mexico over the past few years, and USDA is rapidly preparing for a domestic response to this infestation. The historical impacts of New World Screwworm, the slide is a little bit confusing. Basically, if we get screwworm in the United States, it's going to cost billions of dollars. Cost to producers could be 500 million, and the cost to eradicate well over $1 billion if we get screwworm in the United States. So it will be very expensive. We'll talk about the life cycle of this little fly. So the life cycle can go from egg laid to adult fly again within 21 days. So on top here, we have our adult flies mating, and then the females will find a nice little wound or like nasal passage or something nice and gooey to lay their eggs in. Those eggs can hatch in a day.
And then they go through 3 larval stages, and usually about 3 days is when you're gonna be able to see those little larvae moving. Before that, they're really tiny and you have to be really looking closely to see them. And those L3 larvae fall out on the ground, form their pupae, hang out for a few days, and then emerge as an adult fly to start all over. And when you have a cow with a wound, you don't just get one fly, you get the whole family of flies. So this picture kind of makes it look like one fly does this whole cycle, but anybody with livestock knows that flies are all over, especially in the summer. So this just kind of reiterates what we were talking about before. If you see those white egg packets on a wound, that's pretty characteristic of any fly eggs. A lot of times horse people will see those on their horse's legs in the summer. So those are eggs, fly eggs. They like to lay their eggs on wounds. Anything that's open, the umbilicus of baby calves, any tick bites, anything where they can get a little nugget of tissue. The larvae that hatch from the eggs will feed on the living tissue. Sometimes your wound looks small, but underneath those larvae are migrating and eating the tissue underneath. There can be multiple species of fly eggs and larvae in a wound at a time because you don't just get one population of flies in the area, you get everybody in the neighborhood. This is importantly not contagious animal to animal. And the pictures get a little bit more graphic from here on out. So clinical signs, most people know what maggots look like. Larvae are usually visible to the eye by day 3. They can be up to 17 millimeters long, so just a tiny little thing. Can you smell this picture? The smell is a unique one that if you smell, you will remember forever. A lot of times there's some bloody serous discharge, and sometimes you just have, again, a tiny wound, but underneath there is a whole little moving colony of things. These animals, as you can imagine, feel yucky. They're depressed. They don't want to eat. They don't hang with their herd. Wherever they're probably scratching or shaking wherever they have this infestation. So morbidity and mortality. Morbidity can vary between regions, and it kind of depends on your environment. Like say you have calving occurring and you have a lot of baby calves on the ground, your morbidity could be very high. But if your animals are more spread out, there's not wounds, your morbidity might be lower. So it really depends on the environment and, you know, the animals that are present for those flies to live on. And how quickly it's treated. So if you get one animal infected and you treat it and you resolve it, it's less likely to become a problem in your whole herd. But if you let it go undetected for a while, you're going to have more animals affected. Mortality does happen with screwworm infestations. If it's not treated, usually those animals will succumb to their infestation in about a week or 2. And then in baby calves, if they get infested with screwworm, they usually don't make it. All right. So here we see like a bunch of different sections of the life cycle in one spot. So you see eggs there at the top, probably laid by a bunch of different females. They can lay like 200 to 300 eggs at a time, and they live for about 30 days. They mate once. They can lay like thousands of eggs in their lifetime. There's a mama fly laying more eggs, and then maggots of different sizes are down here. So there's a lot of stuff going on in that wound there. This is a deer, probably a key deer from 2017 that has a wound on its neck. You can see the larvae and then some flies under the ear. These are really, really nasty wounds for these guys. This is another deer where its antler has gotten, there's a wound there. The flies have gotten in, the skull is affected. That's not a good way to be. Screwworm can infest any warm-blooded animal, including birds, wildlife, livestock. So this chicken you can see has an infestation around its cloaca. Here's an example of a pig. This is a little bit harder to see, but there's some larvae down here at the bottom of the mouth. So it can be anywhere. If you're seeing a wound and you see maggots in it, especially if you're in the South, please let us know. This is a kitty, probably had an ear infection or ear mites, and then got a scratch or a bite wound, and now has maggots in its ear canal and around its head. Distribution and the current outbreak. So this picture shows what we previously did with screwworm is we pushed it down from 1957 to 59. We pushed it all the way down here to the Darien Gap between Panama and South America. And then it's been slowly coming back up over the last few years. The Darien Gap is the narrowest spot between South America and Central America, which makes it a good barrier because it's a smaller piece of land to protect. COPEG is the Panama United States Commission for Eradication and Prevention of Screwworm, and that was formed in 1994 to help maintain that barrier and keep screwworm in South America. Yes, so the COPEG was formed in 1994. Primarily, the production facility is located in Panama. That's been changing over the past couple of years. It employs about 570 people in Panama, and they started producing sterile flies in 2006. Originally, there was dispersal centers based out of the airport in Panama City, and then in Honduras, which was kind of in the central of the country. So kind of like Central America. But that's all changing. USDA likes prongs, so we have a 3-pronged approach, but now we have 4 because of the Grand Challenge. So there's 3 main interventions that we can do for eradicating this disease. A lot of people focus on the sterile flies. That's just one piece. Yes, it's very helpful and has been very useful in the past, but we're planning to expand the production and dispersal capacity along the border. Again, this will be primarily centered at the Moore Air Force Base along the border in Texas, at least to start with. Brian talked about how this moves. Screwworms usually move small distances on their screwworm flies usually move small distances on their own. They move big distances when an infested animal gets moved. So there's a lot of illegal animal movement that has been slowly moving this infestation more north. And then quarantine practices and following the quarantines is really important to keep that where it is. There's been a lot of work with Seneca about checkpoints, examining animals as they're moving through Mexico. It's really important to just look at all the animals that are moving and make sure nobody seems like they have an infested wound. So as far as what people can do, just keeping a really close eye on your animals, focus on pest control, treatment of wounds, veterinary care. Keep an eye out for New World screwworm, and then USDA is also working on a lot of outreach and education in Mexico. And then we have the Grand Challenge, so we have more people to help work on that. So the sterile fly technique is really kind of interesting. So there's these huge facilities that make screwworm flies, and they sterilize them, and then they release them into the wild. They can't separate out the males, so they actually do release some females, but females only mate once in their lifetime. So if they mate with a sterile male, they're not going to produce any eggs. And then they go through their life cycle and die and didn't cause any infestations. The facility in Panama can release 100 million flies per week, and that is the goal for USDA to have that ability in Texas as well. And they have flights that are coordinated every week and targeted dispersals of the flies in areas where we're most concerned about where it's progressing to. So the focus has been more north lately because we're trying to stop the northward movement of the flies. This is an outdated map. Brian showed the current one from the website. So this green area, which is the dispersal polygon, is actually up to here now. This map is from January 2nd. So the red dots are active cases, and then the dispersal centers are hard to see. There's one right here, and then eventually we'll have our USDA one. This is the Moore Air Force Base there. And so it's just been creeping north. So things that USDA has done to work to keep this out. In July of 2025, all imports of cattle, horses, and bison from Mexico stopped. This continues today. Dogs can still be imported from Mexico, but they have to have an examination and a health certificate within 5 days of movement. And then they have to be treated, quarantined, and then released. So not a lot is moving across the border legally. So you're at your house and you see this shiny green fly. Now what do? Step one is you call somebody. That's why we're here. So call somebody. There's a 24-hour number. So if you're worried, please call. We've gotten several calls from the public, people, veterinarians with, hey, I'm worried about this. Can you come and check it out? Luckily, they've all been easy to resolve and no concerns, but we're thankful that people are aware and are calling. If you have animals, seek treatment for your animals right away. Don't throw the larvae away. Don't throw it in the trash. Don't throw them outside. Try to keep the larvae as close as you can. Don't move your animal except to the veterinarian. And then if it's you, please go to the doctor or call Stacy. Call Stacy. Wipe down anything that might be contaminated, and then protect yourself, of course, because you are a warm-blooded animal and Screwworm will like you too. There have been a few cases of New World Screwworm in humans. Usually these are associated with recent travel. They can be anywhere, like in your nose. The most recent one was on the scalp in human, I think. And then they're really painful. It's itchy, stinky, bloody, painful. You can sometimes see the larvae, sometimes not. And then you oftentimes will get a secondary bacterial infection on top of it. So if you suspect New World Screwworm, call your doctor, call your vet, call the USDA, call the board. If you see maggots, put them in a container with alcohol. Don't throw them away. Don't throw them outside. Don't feed them to your chickens. Don't do anything. Just put them in a jar. And then report. Preventing New World Screwworm. Keep your animals as safe as you can. Watch for signs in animals. Inspect animals that have traveled internationally. Handle livestock very closely. Try to minimize sharp objects in their pens and where they live. Postpone any procedures that you can, like dehorning, branding, shearing, castration, or maybe alternate the method that you use for that if you know that screwworm is in the area. Treat wounds and the umbilicus very promptly with an approved insecticide. And then protect your pets and livestock from ticks if possible. The USDA launched this new website called screwworm.gov, and that is where you'll find basically everything USDA has published or has available on Screwworm. The great thing is that a lot of this stuff is also available in Spanish. So hopefully will be helpful people on the farm and in maybe other countries too. So check out that website that has the most up-to-date map. All the updated information, the press releases are on there. Oh, I forgot to talk about the map. Sorry, I'm gonna go back. I gotta find my map. Okay, sorry. It's my squirrel brain. Okay, so the Air Force Base is here. We're starting to plan to disperse flies along the US-Mexico border, but there's already like more than 120 trapping sites along that border. So when we start to release flies, we know that we're probably gonna collect some of the flies that we released. So we're gonna try not to panic when we catch those. And USDA is actually dyeing them with a dye that fluoresces under UV light, and you can also see with the naked eye. So if we get those in our trap, we'll know like, hey, we released those. Those aren't actual screwworms. So that's I don't know, I thought it was pretty neat that we're still able to do monitoring that tell who's a good fly and who's a bad fly. USDA has 2 response policies. We like to make documents about things. So the green book is the long version and the playbook is the short version of what we will actually do. You can find those online if you feel like looking them up. But the focus of the playbook is for farmed animals and wildlife and what USDA and our state partners will do if and when we get screwworm. And that is a big jar of larvae. That's all I have for you guys today.
That's gross.
As you.
Thank you. Your map picture, and your comments about how they're going to be dyed is really interesting, and brilliant. Whoever thought of that,
Yeah.
That's a good idea. My question, it's kind of a 2-part question. The facility in Panama, I think this has been talked about in previous meetings, but does the Mexico government, do they own that facility?
No, that's, the facility in Panama is a cooperative plant between Panama and the United States.
It is, okay.
So we've been working mostly with the Senacica, the Mexican version of USDA, on activities in Mexico. We've had numerous teams of USDA folks traveling to Mexico to work with them and kind of make sure everybody's on the same page and working to put down as far as we can if we can.
And maybe you mentioned this and I missed it, but the sterile insects that are released, I think you said 100 million insects a week. But what is in terms of area coverage?
So
do you know what that is?
Yep, so right now, it's the green polygon on the map. That's where they focus. Whoops. So they're, if you can imagine that map, they're coming up the like east edge of Mexico along the Gulf of Mexico. That's where they're targeting now because that's where the cases are the closest to the United States.
Gotcha.
I don't know the area that they drop those flies in, but there's multiple planes each week that are taking flies out and dispersing them wherever is strategically the best place.
Is there concern that it'll spread elsewhere in Mexico? I mean, is that being addressed also?
Yes, so obviously USDA's focus is keeping it south of us.
Okay.
But Mexico is also working, doing their own things to try to protect their own agriculture. I don't know, I'm not familiar with the agricultural regions of Mexico. Like, are there mountains that make it less likely? Is agriculture centered here? But I don't.
Mexico City is on a big mountain.
Yeah.
So I think there is a mountain range there that's keeping them more
to the east.
But
the component that we keep asking about is the wildlife. So Mexico doesn't have the same kind of oversight or surveillance program that we would have of wildlife, so that's a big part of it too. You know, mountains or not. If this gets into the wildlife, and that's why I mentioned the feral dogs, that's been a real issue in these areas, you know, that's part of the wildlife, I guess, so. There's populations that perpetuate the larva that they don't have as much control over as we would.
And as we know, with high paths, we can't tell wildlife where to go. They go wherever they want.
Question, on the field surveillance part, like when they find larvae or they find eggs, from the time they see that to knowing whether it is been in a new school or not, how much time does it take right now?
So they're sending those to NDSL, and they have a very small team of entomologists that are there identifying larvae and flies. So currently that's the plan, is they're going to NDSL. I think there is a plan to expand that knowledge to other universities or labs, but currently.
In one of your slides, did you say the larvae goes into the ground and then it come? So is there anything we could like spray over that ground to kind of kill them, or?
That is a great question. I don't know the answer to that.
Okay.
I can try to look into that for you, because that would be, I mean, if you can treat the land.
I mean, if we can kill them that way, I mean.
One more.
Yeah.
But anything you put on the land is gonna be eaten by the cat.
Right,
So-
yes, it'd be pretty limited on.
Yeah.
I think that's part of what they're looking for in this grant challenge.
Yeah.
Things like, you know, what are the treatments? So we keep hearing about feral flies, but that's only part of the equation, like Mackenzie said, so.
So now
Yeah.
you can submit a grand challenge.
Yeah. One more current event I forgot to mention in mine, there actually has been detections in the US that aren't reported. So I just heard on my Nassau call yesterday, there was a horse in Florida that had New World screwworm larva detected. It's not reported though, because it's in quarantine, so it's not considered in the US yet. So I think, is it returned or did they treat it? It came from Argentina, but
They treated it on site and destroyed anything, you know, bedding and all that type of stuff.
So point being that it's, you know, it's getting here and we're able to catch it so far, but some of these other cases, I remember I think it was the one that was closest to Texas last fall. I thought they said those animals had been examined 3 times before someone identified that there was a larva there. So it's, I mean, I suppose, depending where the life cycle is, if they're freshly hatched, you're not gonna see them.
How
but
wild the cattle are.
yeah. So a lot of surveillance going on, but opportunities missed. I mean, when you're looking for that specifically.
I think we have to presume that migratory bird season is gonna be the greatest risk to.
Brandon?
I've had and screwworm gathers, what you're saying.
Couldn't they just, after doing inspections, treat all woods with the pesticide just in case?
I would think so. I don't know the availability of the US approved treatments. I think the Exalt is basically the Bravecto formula for dogs that's been reformulated for cattle.
Oh, I thought it was just the regular old Dectomax.
That was one of them. Max and Exalt are both approved for cattle, and then
Yeah.
Credelio for dogs and cats.
That's kind of a question that I don't think you would have an answer to. But I work for a company that has a generic Dectomax. And I imagine we'll have to get a label change before anybody could actually use it for that purpose.
I don't know.
And I imagine the label change for the Pioneer companies, they've already been working on getting that done. And so, they'll have a leg up on any treatments that will be happening to cattle in Texas.
We'll need a lot of options and a lot of drugs if we get there.
But the Prenomectin is not.
That's not on the list.
Yeah, well, they're different enough. It might be that the Doramectin is just a little better than a Prenomectin.
You're looking at me, Peggy, like if I need to count. I believe it.
I used to work for Pfizer Animal Health when Dormectin, Deptomax came out.
So the benefit, this is just speaking of, but the benefit of the aprenomectin or the like long range would be the longer term benefit, is that what you're saying?
No, I'm just saying that there's two molecules out there that are very similar and yet different than from the ivermectin.
Okay.
So there's ivermectin, dormectin, aprenomectin. All do sort of something.
Okay.
So
I think a lot of these antiparasitic drugs and insecticides that we use routinely are going to be effective, but we're limited on that labeling claim. So you can use them off label to an extent,
veterinarians could prescribe it off
but
label for sure.
But if we're looking at really controlling the methods, it needs to be on label, so.
On the label.
And I don't understand why they don't go with the generic instead of a label claim for a specific label, you know,
Well,
a brand name.
I don't know if I can say very much, but early on, we were asked how quickly we could increase our production of our parasiticide. And these are pour-ons. Okay, so these are things they just pour down the middle of the back of the animal. Not very difficult to do. I say that, oh, it is. I'm sorry, because I've been there, and it's a challenge sometimes to get all those animals through a chute, something on their back that's gonna stick, and the right dosage. Because you'll just create resistance if you don't get the right amount on there consistently.
Any other questions or comments?
So just a quick comment about the human cases. So similar to what Brian was saying, there have been importations of people who have traveled to endemic countries. There was one this year that I think we talked about meetings ago, and cases prior to that too. So again, it's but we are trying to raise the awareness on our human clinicians as well, especially like travel clinics or people who serve people that travel routinely to these areas as well. But if there is a human case, there will be a USDA response around that area and trying to figure out how long they were here, if any larvae have fallen off, and all of that as well. So, yeah. We'll be part of that.
Thank you. Yeah, we are on schedule, so we're going to break for lunch. We'll return at 12:20. Good job, everybody. We're right at 10. All right, 12:20. We'll go ahead and get back started. Looks like we've got our next presenter here. So we are ready when you are.
Well, thank you, everybody, first of all, for letting me, giving me this opportunity to be here today to present an update on our wildlife biosecurity assessment project that we have in Minnesota. So my name is Jason Gilsdorf. I'm with USDA Wildlife Services. The Wildlife Biosecurity Assessment Project was a project that we started here back in 2023. Originally, actually, before I get too far ahead of myself, I'll go ahead and get the slide up here. So, if you've been around for a couple of years, you're probably familiar with it a little bit. Just want to go over a little bit of a review. So the project started out as a pilot project with North and South Dakota, Minnesota, and Iowa. Involvement in the project is voluntary. So producers, it's up to them if they want to participate or not. The services that we provide, which we're going to talk about a little bit and go over today, there's no cost to the producers. So it's a free service to the producers. I have an asterisk there, which I'm going to talk about in a minute. The Wildlife Biosecurity Assessment Project has basically three main components. A wildlife biosecurity assessment is an actual assessment of the barns or the structures containing poultry. And we walk around the outsides of the barns. We do not go inside. We don't cross the line of separation. But we're looking for what we call hazards. Just different things that could be wrong with the barn, issues, holes, that kind of thing. where there's potential for wildlife to introduce avian influenza to the domestic poultry inside. So the assessment of the barns is one thing. We do surveys of wildlife, so we do point count surveys, where we stand in one point for 3 minutes and we identify anything we see or hear within 100 yards of our point, so 200-yard diameter circle. And then we move across the several points across the farm where we're looking to identify any wildlife that we see. We also do a mammal survey, and that's at night. So an hour after sunset to an hour before sunrise, we go out with a thermal camera, or a viewer that we can go out and look for mammals that we might see, and we just document those. So as you can see there, the main components of the assessment there are of the project, the assessment of lines and the surveys. They're done every 3 months, a quarterly. So 4 times a year we're doing those. The last thing that we typically are going to be doing at these facilities is direct control. So direct control is a term that we use to say that we're actively managing wildlife. So whether we're dispersing them, we have lasers that will take out there and we'll shine at them. We slap our hands and chase them away. We also do some lethal control. So we have pellet rifles that we can use. We have shotguns. We haven't used shotguns at any prems yet, just as a noise issue. So the last thing that we're also using are traps. So we have different types of traps, whether it's traps for mammals, cage traps, foothold traps. We also have pigeon traps, starling traps, sparrow traps. We have different kinds of traps we can put out in the field. So when we're dealing with wildlife, we're operating under different permits, and we have a U.S. Fish and Wildlife Service permit that allows us to manage the wildlife or the birds that we're seeing on site. And we also have a permit with the Minnesota DNR that gives us permission to manage birds and mammals. A couple of updates now. So I mentioned it started out as a pilot project with those 4 states. This WBA project has now gone national. So it's across the country, all 50 states can participate. Our leadership is pushing us to try to strive to do all 3 components of the WBA project on the prems that we're working at. I mentioned it's a free service that we're doing. So veterinary services also has a biosecurity incentive program that producers can participate in. And if they're going to participate in a reimbursement style program, then they need to sign up with a reimbursable agreement with veterinary services. However, that agreement is only between veterinary services and the producers, not with wildlife services. We can still do WBAs without that reimbursable agreement in place. So getting back to that asterisk up above, our leadership is basically telling us that if after we have done 3 WBA wildlife biosecurity assessments at the prems, we're not seeing any of the hazards that we're identifying being mitigated by the producers, then they're asking us to either talk to the producer, number one, and say, hey, if we're going to continue this, you need to start fixing some things. Or if you don't want to fix any of the things that we're identifying and giving recommendations for, then it's no longer a free service. Then we may ask the producers to pay. We haven't experienced that yet, so that hasn't been an issue. But that's what our leadership is basically pushing us for. The last thing I'll mention is we only have 6 employees right now on the WBA project in Minnesota. So we've got them spread out a little bit here. I got a map coming up next, but if we don't have a wildlife services employee in the general area of the prems, we may not be able to provide this consistent direct control work at these different prems. But what we can do is do that initial WBA and likely some follow-ups for them as well to keep providing recommendations and some reports. So there's the map of Minnesota and where the 6 employees are located. You can see up there, I'm up just south of Henning and Otter Tail. We have Ben over by Brainerd, David's down by Rice, Trevor's in Hutchinson, Ben's in the south side of the cities, and Dean's down in Canyon. So to date, since the project started in 2023, we have assisted 83 different poultry prems. So we've worked at 83 different prems that consists of 13 different producers, primarily turkey producers, but we do work on a couple of table egg laying producers also in Minnesota. We've conducted 148 actual WBAs. So 83 initials and then 65 follow-ups. We are currently, with the geographic spread of employees that we have right now, we're working about 26 prems actively. And that entails or covers 6 different producers. So you can see our challenges there. Our geographic spread has been a challenge because we do have producers requesting WVA services in areas where we don't have someone close to. We try to basically have farms within a 1-hour drive of an employee, and then they're working those farms just to keep things efficient, so we're not spending a lot of time behind the windshield driving. Another thing that we've been dealing with is when we open up some positions, it's been tough to get applicants. And I'm not saying this is a wildlife services thing, this is across the nation. I mean, it sounds like everybody's having a really tough time filling job vacancies right now. So we've been dealing with that, and we're actively looking, within probably another couple of weeks, we're gonna be opening 2, likely 3 more positions for the WVA project. We'd like to get another one up in that Becker Outer Tail area, Todd, Wadena area. Maybe down around Wilmer area to get another one down there, even down Renville, coming down that kind of area. We've had some producers down in that country too, where if we could get an employee down there, that would be good for us to get up there and help those folks. So with the WVA side of things, as I mentioned, we do the assessment of the prems quarterly. So every 3 months we're doing that. We walk around the outsides of the barns and we have Survey 123. It's an app on our phone that we are marking hazards. So we enter all these hazards and we classify them into different categories. Those different points there you see, compromise, exclusion, those are different categories that we'll group them into. And this is a picture of actually from one of the reports that we do. We provide this to the producer and it shows them a map of every hazard that we identified. And then you can also see the different categories of hazards on the side there too. We also group those categories into different tiers, 3 tiers, tier 1, 2, and 3. Tier 1 is the most important as far as direct contact with wildlife to poultry inside. Tier 2 is a secondary type thing, like maybe a bird nest on the outside of a barn. And then tier 3 are largely attractants, spilled grain, water, that kind of thing on the premises. So I'm just going to take a couple minutes here and show a couple examples of the more common things that we do see out there. And these pictures that I'm showing you may not be super obvious, but we look pretty fine detail. So when we're out there at a farm and looking at the barns, we look for anything over 1 inch. If there's a hole or a gap or something that's over 1 inch, a house sparrow can get through that. So on that left picture there, you can see the red circle. That 1x2 mesh has a chunk missing out of it. Now we got a 2x2 hole there. House sparrows can get through that all day long. So tier 1 hazard, direct access. Wildlife can get right on the other side of that line of separation. The ventilation fans are another common place that we see some issues. There you can see a power cord going through the louvers. Props that louver open, there's potential for wildlife to be able to get right through that. So in any of these fan situations, our across the board recommendations, we always say put 1x1 inch wire mesh on the inside of the barn right behind those louvers. Even if those louvers break, have a cord going through them, they fall off, wildlife is not going to get through that 1x1 mesh on the other side. Some open holes, they can be a result of damage. A skid steer or something runs into the side of the building, pokes a hole in it. You have penetrations going through the walls from different kinds of utilities and that kind of thing. So a couple of examples there where those the feed augers go through. Oftentimes we'll see some issues there. The middle picture and the picture on the right, you can see the actual some feces. So that's proof that wildlife are using those holes for something. Now, another thing I will mention, we don't go poking our fingers in thing with a flashlight looking and we don't see, does that hole go directly into the barn? We don't do that. So if there's a foundation breach or something, we just see a potential there, we can document that. Now, if on the other side of that, there's a concrete wall and wildlife can't get through, if the producer tells us that, now we know that, we don't mark those then. If these tier 1 hazards are marked and they're participating in an incentive program, the producer will likely have to mitigate all tier one hazards. So if we're marking tier one hazards that technically aren't a hazard because of a concrete wall on the other side, if they let us know that, then we just take those off that report and they don't have to address those. So just some examples here, a couple of foundation breaches. Again, we're looking small. Anything over an inch is basically something we're gonna document, and we do not go poking around. So if there's a concrete slab and the cameras cannot get through that, if the producers let us know, we can definitely remove those things from the reports.
Can I ask you a question?
You bet.
The slide, the previous slide. This may be a silly question, but the picture on our left, the feed auger. That's not enclosed.
No.
So was that a barn that's not in production, or was that a repair that they needed to do? Can you just explain that picture a little bit more?
I don't know the exact details of it, but when I looked at it too, it's missing the PVC, that the pipe on the outside.
Yeah.
So I am assuming that that particular thing was under construction or it was being fixed or something. So, you know, every so often when producers have to clean out the barns and there's no poultry inside, but they leave the doors open and they're in there working and whatever. If we're out there doing an assessment at that time and we see that, we may document it as an unguarded access or something like a door's open. But we will say in the writing saying, you know, during or at the time of this WBA, whatever barn was under construction or was being cleaned out or whatever. So we'll make a point of it, but we typically do try to recommend, even when you're cleaning them out, don't leave the doors open overnight. Because I mean, birds, I've been at farms before and producers are saying, oh yeah, there's swallows inside there all the time or whatever, birds going in and out. So anytime a door or something is open, even if there's no poultry inside, wildlife could definitely be going in and out of there. If they're cleaning this thing out and they get new litter in there and everything's getting ready to restock it with birds again, and you have birds in there, they could get trapped in there. Or even if they're in there before birds, they could be defecating in there. And if there's potential virus in their feces, we try to do everything we can to keep wildlife out of the barns. But yeah, you're right. You're looking at the inside of that feed auger there. It's definitely, that's not how it would work. There's normally a piece of PVC or a pipe or some or a metal pipe going through there. But yeah, so, but even with that, we've seen, even with the actual pipe there'll be enough of a cutout around that sheeting where there might be a 2-inch gap on there. So that's an extreme example, but yeah, we actually have seen where those feed augers or feed tube lines go in, they will sometimes have issues there where there's some additional sheeting up there, some spray foam or something just to stop the from getting through. But yeah, good catch. Yeah, obviously.
I'm not trying to pick on your picture.
No.
I just was like, that is not right.
No, that's not right. You're 100% right. But that's a good point. It brings up in that even when the things are down for repair or whatever, we do try to tell folks, hey man, I get it, you know, they're being fixed right now, so they're not buttoned up like they're gonna be, but there's still potential, and we try to minimize that for any amount of time. Yep. Thank you for the question, because that was good to call that out. So here we're talking a little bit about the tier 3 category or like attractants. We see it often, especially by the feed bins, grain feed spilling, whether there's a hole rusted in the bin or a crack or something in the equipment there. It's a major attractant for wildlife. And since I'm talking about this, I'll just mention real quick too. So I'm gonna talk about it next, but we talk about trapping and putting traps out. If we put a pigeon trap out, a sparrow trap or a starling trap or something like that, we put food in there. Got to get them to come in the trap. If that's out there on the field or on the site, they're going to eat that before they go in our trap. So it's almost like a competition. So for our traps to be the most effective they can be, we try to minimize the other food that's available on site because we want them to come to our stuff. And then water. And again, if it's a wet year, if we do a WB right after a heavy rain, we'll oftentimes mark right in there. Maybe we identified 6 standing water on the site. We'll say we did this WB right after a heavy rain. And the kind of the detail for that is if water remains after 48 hours after a heavy rain or snow, we recommend that the producers mitigate that in some way, whether they improve the drainage there so it can flow away, or build that area up so the water doesn't form there. But 48 hours is the cutoff. If water stands for 40 hours or more, then we often will mark that as a water attractant. So, direct control, I mentioned pellet rifles, that we're using, so we actively will shoot some birds. And then we also have access to traps. So on the left there, you can see a starling trap, and kind of hard to see, but that's actually a trailer. It's like a 5x8 trailer. We can catch hundreds of starlings at a time in those things. They're pretty effective. So we have a poultry water in there, 5-gallon water, and in the back there, we have bait that we put in. It's a bird carrier bait, high fatty acid or high fat content bait that we use for catching starlings. The birds come in on the top cage. It's like a minnow trap. They go through like a little funnel and they can't figure out their way back. And then there's PVC that can drop down inside. And once they drop down inside, they're pretty much stuck. Occasionally, one might be able to fly back up, but it's not super often that happens. And then we have euthanasia chambers that we bring in, and all the birds go into that, and we euthanize them with CO2 gas. Same with pigeon traps. These are one-way doors. Pigeons are pretty feisty. They'll push their way through things. So there's just one-way doors here that have a little bit extra of a slot. They see that, they'll push through, it opens up and it falls behind, closes behind, and can't get back up. And then, like I mentioned, we do have sparrow traps. So I'm talking a lot about pigeons, starlings, and house sparrows. Those are the three main species we see at a lot of the farms across the state. Those three species don't migrate. And another thing about those three species is they are not native to North America. So I mentioned permits at the beginning. The U.S. Fish and Wildlife Service and the Minnesota DNR, they do not protect European starlings, house sparrows, or pigeons. Rock pigeons is their property. So technically, no permits needed for that. Now, we're not downtown Minneapolis whacking pigeons with a shotgun or something, but we don't need to have a permit to deal with those species. We see them at basically every farm we're working at, and they're one of the ones that we pick on a lot. They're small, like especially the house sparrows. They can get through anything over an inch. They can get through a hole that big. So they're one of the species we pick on a lot because they're pretty accessible. There's not a lot of regulation behind them, and they're very common and they're here year round.
So you get rid of those birds, but there's more birds.
Oh yeah, always, always. The thing is we're never gonna, it's never gonna be a sterile environment. We're not gonna get rid of all of them, but if we can get rid of some, it just helps. So we're just trying to reduce the densities on the pens.
The old adage, the solution to pollution is dilution.
Pretty much, yeah. But you're right. I mean, you're never gonna get rid of all of them. There's always gonna be something wrong. We're just trying to reduce numbers.
Just curiosity, but using the starling, do you destroy those on the site or are they taken somewhere else and then?
Everything would be euthanized on site and they'll be disposed on site. So yeah, if there's any wildlife that we take at the farm, it doesn't leave the farm. We have CO2 tanks in our trucks. We have euthanasia chambers. We have the hoses. It's really, those starling traps are something that we've really been fine tuned here in the last year, and they're pretty slick. But you don't, I mean, we're not, if we have 200 starlings in there, we're not euthanizing 200 at one time. They come out in batches just because our euthanasia chambers are very small. But yeah, then we bag them up in trash bags and they're disposed on site. They're in the dumpsters on site. And we will oftentimes, I'm going to talk about it here in a little bit, but if we have wildlife in hand, oftentimes we try to sample that as well. Just doing regular surveillance, looking for high path AI in wildlife on farm. So I will say, producers are being proactive. We have many that we're working with at the appreciator reports. They go through them with the farm supervisors and the managers. We're seeing mitigation being done. They're trying, and that's what we have to ask for. I mean, as long as they're trying to do something. Now, whether they're the tools and techniques that we have to use, nothing is 100% effective. But the point is you got to try to do something. Another report that we give producers is the wildlife biosecurity management summary. So I mentioned all the three components that we're doing out there. So the WBA, the actual assessment of the barn structures themselves, that's one part of it. The summary report, the WBMS, it takes all the components, the WBA, the surveys, the mammal surveys, the direct control, and it puts it into one report, and we give that to the producer once a year. So that report will show actual data that we collect, will show the hazards that we identified from previous assessments. So we have maps up there. You can see how, things are moving. We show them a graph or something to show trends. You would think that trends, that the hazards would always go down. It's not always the case. There's damage happening all the time. So sometimes things are ticking up and down. Right now, we're having a normal winter. It seems like up in my country anyway, we have snow on the ground. We're not going to be able to document foundation breaches very well in the winter without much snow on the ground. So these counts might go down. If we ever see something that's responsible for that, like snow, we'll put a comment in the report. We can say something like, hey, snow conditions during this WBA didn't allow us to likely document all the foundation breaches that could be out there. Yeah, I think that's good for that one. So the next thing, I talked about the surveys. So the Wausau Wildlife Abundance Survey, that's the point count where we stand in one spot for 3 minutes. And then the mammal surveys, those are at night. We'll have a table in this report that will show all the species that we identified. We'll have graphs showing the different trends at different times of the year so we can see how things move. Usually things go up in the spring because springtime migration, birds are coming back, it steadies out for the summer. And then the fall, we'll get another little peak as the fall migration comes and birds are coming through. We also provide a heat map. So the surveys are conducted at points. So we get to a farm, we can look at an aerial before we get there, but sometimes we have to kind of ground truth it. We get to the farm, and we want to stand at a point where we have good observation of the area so we can see at least 100 yards. And then we scatter these points around the farm. We identify anything, like I said, within 100 yards of where we're standing, and all these points are plotted, and then we can produce these heat maps. And it can show points of higher densities where we're reserving more wildlife. And it can show the producers, we're seeing a lot of wildlife right in this area. What's going on? Or something's there, right? And that likely is what it is. It's going to identify an attractant or something of some sort. And if nothing else, it'll show the folks the habitats that they're using too. So the main thing it does is identify attractants. So, this is similar. The direct control that we're doing, we're walking around out there with a laser or something like that, and we're chasing wildlife around. We're documenting those in our app as well. Again, we can produce a table. We show all the different species, the number that we removed, that lethally removed, and then any that were dispersed or hazed away. And again, we provide a heat map. So in this situation, I asked what the report I pulled this from, the author of asked them what was there, and they said it was a dumpster right there. Makes sense. Dumpsters are a hot spot for wildlife. They're always out there hanging out and eating whatever's in the dumpster. Feed bins, another place. You'll see those oftentimes wherever feed bins are, you're gonna get a hot spot on all those. So the last part of our WBMS report is recommendations for managing the different guilds of birds. And when we say a guild, what we do is we take groups of birds, different species of birds, and we put them into groups that have similar habitat requirements. So shorebirds, forest birds, grassland birds. Just group these different species into groups called guild. You can manage those species within that guild, usually with the same types of methods. So we have a section in there, we have a paragraph about columbids, your mourning doves, the pigeons, aerialists, swallows, cliff swallows, tree swallows, barn swallows. And we just give different recommendations on how to manage maybe the vegetation that's around there. If they're insectivores, maybe we recommend that they apply an insecticide to control the number of bugs that are out there available as a source of food for these birds. So we'll give them some recommendations on the different types of birds in the on the farm, just to how to manage that farm to attract less wildlife. And we tell them when things don't work too. I mean, if something's not going to work, we say, yeah, that this is pyrotechnics or lasers might not be effective for certain species. And we can flat out say that in there. So yeah, lasers aren't effective for this species, but here's some other things that might. I mentioned sampling if we have birds in hand. So tons of text and stuff on this slide here, but this is looking at since the inception of the WB project in Minnesota. So back to 2023, the fall of 23 is when we started. Since then, 338 samples. You can see the breakdown there. I won't go into tons of detail. The next slide here, I will show just in 2025, so basically the last year. But you can see the breakdowns, different species, our top breed, house bird, pigeons, starlings, 17 different prens. We collect the samples across 12 different counties. In the last year, since this is just calendar year, this is calendar year 2025. So 238 samples collected. You can see the breakdown between oral colical swabs and then blood. Species again, house sparrows, rock pigeons, starlings, and killdeer were tied for number 3 as far as the number that we sampled. 14 different prens and 12 counties. So one thing I just learned this week, in December, we collected a dark-eyed junco. That's this guy up here on the top right there. That's a dark-eyed junco, sparrow-sized bird. He's like 6 inches long. They're here, very common in the winter. We detected an initial H5 detection in a junco in December at our wildlife disease diagnostic lab in Fort Collins. That sample was sent to the NVSL. So I will preface this a little bit. So it was collected in December. The holidays happened. We couldn't ship over the holidays because the lab wasn't going to be open for collecting samples. Things got pushed back a little bit. So the samples didn't get actually tested until late December, early January. That potential presumptive H5 detection went to the NVSL for confirmation. And we just learned this week that the NVSL did not detect it in that sample. So not sure what happened there as far as we haven't heard anything from the lab yet, but just an update on that. It's kind of some excitement there. This was at a clean farm. This was not at a farm that had broke with high-path AI. This was at a clean farm that was operating normally. And everything was fine. The farm never went hot. And then you can see another thing we have pending there is a blood sample. And of course, we're looking for antibodies there. And that was a ring-billed gull. That's how we see that bottom picture there. And you can see they get their name because of that black ring on their bill, ring-billed gull. So we continue to sample wildlife if we have wildlife in hand. We will be sampling at clean farms just as routine surveillance, looking for wildlife or looking for AI in wildlife. And we also, if we have personnel and the availability of time to go to prens that have broke with AI, we try to get to those within roughly 2 weeks of the farm breaking. We get it's pretty busy around there right after. We'll show up to those. We try to collect as much wildlife as we can to sample just to see if we can find AI in the wildlife that was at a hot farm as well. So some other outreach things that we're doing right now, the peak convention with the Midwest Poultry Federation. We did a presentation and a booth in 24, 25. We had just had a booth, and this year, just learned this week that we will be doing a presentation during the educational portion for the educational talk, and we also are going to have a booth again at Peak 26 down in the cities. That's pretty much all I have for you. So, like I mentioned, so if folks are interested in having a WBA at their prem or at their farm, we ask that they can submit a request for that at that email there. If they want, they can also come straight to us, to Wildlife Services here. There's my information, and then Gary Nornberg, he's our state director down in St. Paul. So those are ways you can track us down or request WBAs. Also, I'll throw out there, if anybody knows anybody interested in looking for a job, wants to work for the WBA project, give me a holler, send me an email. That's all I have for you. Does anybody have any questions or anything? Oh, yeah.
I have 2 questions, actually. Do you have any data on the number of prems that have had a WBA that have then subsequently tested positive for high-path?
We could go back and find it. We haven't, it's not something that we've been actively looking at, but we can I do track that. I track the prems that we have done WVAs, and then if they do go hot, I do document that they have. Yes, so it's something you could get.
Sure. And then what percentage of your WBAs do you actually identify a problem that needs to be addressed? Like, do you ever go out there and like, this looks great and everything's perfect and we don't have any further recommendations? Do you find something on most firms?
Yes. Yeah, I don't know that we've ever, I think we did one. I think we did one prem where we didn't find any hazards. And our WBA was basically one page. Looked awesome. So, but I will say that is not the norm. I would say, I mean, of the 100 and some that we've done, that's happened once. Otherwise, and like I say, I mean, when we go out there and we talk, we look at sometimes the producers will be walking with us. You're gonna count that? Yep. We look through different eyes when we're doing this stuff, and they might not know or realize that they have issues, but when we show up, I don't want to say we're being picky, but we're being very detailed. I mean, we look for anything that we have training saying that that's going to attract wildlife or something's going to get through that. So, yeah, everything, and it's the gamut. It's the gamut. Some of them are locked down tight and they look awesome. And the next one, we have holes this big with turkeys looking out of them.
Yeah.
It's insane. I mean, it's possible.
Another question I just had when you were presenting was, you said if you saw standing water, you would notate that, but then how would you know how long that water, like, would you come back to see if that standing water was still there within that 48-hour time frame?
We don't come back, but we have it in the findings, basically the recommendation. It would be a tier 3 as an attractant. And we'll say, if this water's standing for more than 48 hours, then we recommend these things. So we kind of leave that up to the producer, but we will note if it's been after a heavy rain and there's puddles everywhere, we'll mark them. But then it's kind of up to them to say, all right, well, that puddle that they marked is gone in a day, so don't have to miss it that one. And a lot of them, you can look at them too. I mean, some of them you can tell if there's mud and there's snails and stuff in there and things have been around for a while. But yeah, some of the stuff you can see it, but we don't actually come back and confirm.
Do you know kind of what the breakdown is between independent growers that you're doing WEAs on versus like a contract grower, like a Jim Young grower?
We don't differentiate, but we could. We have that information, of course, that we can look at the differences. One thing with wildlife services, one thing that we are not allowed to do are disclose who our cooperators are or where we're working. So it's just a thing. We don't actually tell them, oh yeah, we're working at this guy's farm at this address. Even when we show our pictures in the reports, we have some rules that the picture cannot contain poultry and the picture cannot contain any kind of identifying characteristic. If it says Smith's turkey farm on it, that we don't take a picture of that. It's not going to go in a report. So just in case, because I mean, we provide that report to the producer. That's it. We don't share it with anybody else. We give it to the producer, and what they do it from there, that's on them. They can do whatever they want. But we could look back and look at independent versus commercial, sure, without disclosing that kind of info. Yeah, we could do that.
Do you have any aggregate data as to kind of from 2023 through 2025, the type and kind of infractions or observations that you've made? What degree of improvement have you seen across the cooperating piece of the industry?
We haven't specifically identified actual percentages of change or anything like that. But again, I would say it's pretty variable.
Okay.
Sometimes we go and we show up 3 months later with a follow-up WBA, and the person that goes to do the WBA follow-up, they'll look at the initial before they go and they can see what was there last time. We don't actively document, oh, that one's gone. We don't take that one off or anything, but we can look back and say, oh man, yeah, they have changes. But usually what we'll find is new ones.
Sure.
So we definitely see work being done. We see gaps filled in with foam or sheet metal or extra metal screen across things or bird nests knocked down. We definitely see that, but there's typically enough other things. It's not a drastic change. But by and large, I would say, I don't know if there's any pram that hasn't done something here. They're at least doing some. Some of them are pretty easy fixes. But some of them were a little more elaborate. I mean, if you have a wetland nearby and we say, oh, we recommend you move that, well, gosh, that's gonna involve a lot of permits and everything else, right? So all we do is recommendations. We are not regulatory. We don't enforce laws. We don't write fines. They can take our report and throw it in the garbage. I hope they don't. And by and large, it seems like they're folks are looking at these things and taking recommendations. So it's been good.
I was just wondering, this has nothing to do with the biosecurity, audit that a producer is supposed to do to get indemnity if they break more than once. It's a different thing, right?
Yeah.
Yeah.
Yep. So a WBA is another type of program or project that the producer can enroll in as part of those incentive programs. So like, I don't want to get too far in the weeds in this because it's more of a veterinary services thing than a live services thing. But when they fill out that application form to like basically initiate a reimbursement agreement with veterinary services, they can check boxes on what types of things they want, BCAP, BIFA, WBA. They can check one, multiple, whatever they want. But the WBA at this time is not any kind of a thing where they have to have done before they can repopulate, or if you're gonna get reimbursed for something, they don't have to do it. It's right at this time, it's just a voluntary thing. Does that answer that?
Yeah.
And I was wondering if you have any experience with where you go out and do an assessment and then the producer chooses mitigation with the lasers, and then you come back again, if you have seen any kind of, especially with your bird trapping, are you seeing, or do you have any of those in your studies section?
We've been to a couple farms that have lasers on them. However, we were not there before they installed lasers, so we can't do a pre and a post. Again, and like I mentioned, lasers are great. They're very effective for some species, but they're not effective for all species. I mean, there's some species you can shine a laser on all day long. So lasers are great for some species, but they're not for everything. Just like no single tool or technique is going to be 100% effective for everything. So it's definitely something that at least they're trying, but we haven't done something that yet where we've got to it before and after to compare a difference, like with data. We talked to some producers that have done it and they feel that they've seen a difference, but we haven't been able to prove it in data or anything yet. But it was great because we talked to some producers. Oh man, I wish you were here before we did this so we could tell that difference. Unfortunately, that hasn't happened yet.
Any other questions for Jason? So I would, Shauna's question about the correlation between a WBA and a positive farm. If you could provide that information to the Minnesota turkey growers, I think that would be really interesting for producers to know, just that information. So if you can share that, me as a turkey producer, I think would appreciate that. And my question for you is, you talk about how you're being shorthanded. And this is maybe a silly question. You might say, well, we're not done. Yes, but I mean, are you looking for more producers? Do you want to go to more farms and you want, all of that?
Absolutely.
Yeah.
We are 100% trying to grow the program.
Yeah. So I think sharing some of that information too might be helpful and maybe incentivize more growers to participate in that.
Yeah. Yeah, I mean, and spread the word. I mean, if it's a free thing out there. When this first started, and I'm sure it's still happening, I have no doubt, we've seen it, there's been some hesitation. We show up, USDA, whoa, stay off my farm, right? But wildlife services, we're not regulatory, and I know the government says we're here to help. Sure you are, here to write me a fine. We, wildlife services, we are here to help. We're here to give you recommendations to try to improve the biosecurity. So by all means, spread the word, and if folks are interested, then yeah, reach out and we can do any number of things to at least provide some assistance.
Great. Thank you.
Well, I'm gonna one more question. Do you see this as something that, once you guys get really good at what you do and everything, that it becomes a training program so that a producer could do their own, early morning looking for animals that might be coming onto their farm and doing some of these things themselves?
Yeah, I think that's definitely, it's, what we're doing is not, rocket science by any means. But I will say is, when we run into a lot of the folks out at a prem, they're busy. I mean, they're wearing many hats, right? And now if we have to tell them, hey man, you guys have a lot of barn swallows on your barns, you should knock those down. And if they knock them down before an egg is laid, you don't need a permit. Once an egg is laid, there's a chick in that nest, now you gotta have a permit from the Fish and Wildlife Service to knock it out. So what we recommend, we say it in our reports, if we have a nest, we recommend that you be vigilant. And if you see a nest being built, knock that thing down before an egg gets laid. The thing is, if you knock it down tomorrow, in a couple hours, you gotta come knock it down again. So people have to be more persistent in wildlife, and sometimes that's tough to do when there's a lot of other things going on, but people can absolutely do it. If they can find the time to go do it, they can look at our reports and say, oh man, look at the peak in spring. Well, we better expect a lot of birds coming up in the spring. Some of it's fairly common sense, but some of it absolutely. I mean, if we give a recommendation and we try to spell things out, that they can absolutely take that information and do a lot of the work themselves. So.
All right. Great lead into Shauna's update.
Thank you, everybody. Appreciate it. Thank you for the questions.
Just tell me it's right.
That you guys provide, and they say really good things about your audits. Not so much the audits that I get involved with, but.
Yeah. It's like we still want to be in there.
Okay, so, give you a quick update on a couple current things that we're dealing with. High path, obviously, I feel like I give you an update on this every 2 months, and yeah, it's the same old stuff, right? Because it is, we've been in this outbreak now for going on 4 years. Almost a continual response. We get, sometimes a slight break in spring and summer, but then we're right back at it. So these are kind of our current tallies of where we're at since the start of our outbreak in March of 2022. We've had 216 confirmed cases in 53 counties, and we jumped over the 10 million bird mark. This probably just within the last month, we've popped up over that. So as always, all this information is on our website. So if you guys want to kind of track of what's going on, it includes the confirmation date, the subtype, and the genotype, which we'll talk a little bit about. When quarantines were delivered and when they get released, all that information is contained on there. So we thought we were kind of done with stuff, but we had our last case in like mid-December, and we had a month break, and then we had another little roundabout of 4 cases, all frankly within about a week and a half's time, in mid-January. 3 cases in Meeker County, which were relatively close together. And then 1 up in Stearns County. And so, like I said, it had been kind of a month, and I think we were hoping we were on the downward slide, and we had that upcoming cases. But if you look at just kind of where we're at with our fall numbers, that's the table over on the right-hand side. We've had 30 cases this fall. So it was a pretty active season for us compared to the last 2 fall. We kind of had our higher numbers than what we have been seeing, and that probably has to do with, and Jason can correct me on this one when I'm wrong, but that kind of variation in wildlife and their immunity levels and the amount of virus that's circulating there. So we get reports from Wildlife Services, from the Raptor Center, called the Wildlife Rehabilitation Center, right when they find detections of it. And Carol talked about it at our last meeting about why we see that fluctuation. We continue to just do a lot of surveillance. So we get calls weekly from veterinarians, from producers who say, I've got an uptick in mortality. We need to get samples into the lab. And so we do those foreign animal disease investigations that Hemant talked about in his presentation, just to make sure that everybody's looped in and we can get those samples tested in a pretty timely manner. A lot of times I think it ends up being avian metapneumovirus and not high path, but it's still important that we're double checking and doing all of that extra work. As far as the genotypes, what we're seeing in poultry still matches pretty closely with what they're seeing on the wildlife side of things. And that D11 still remains kind of our primary genotype. We haven't had any spillovers between dairy and poultry. As Brian, somebody mentioned, we haven't had any dairy cases since last March. Thank you. And so that's all really good news. We've had a couple of variants, D15 and D1.6 that were kind of unique to Minnesota. As I look across the country, we're not seeing those in other states, but influenza viruses like to change. And so while D11 is predominant now, it's going to continue to mix with other viruses that we see in North America, and we're going to continue to see change. And I think that's just kind of to be expected. As far as our current response activities, we're still considered in an active response, thanks to the community for all of their help in helping to manage that. We've still got 15 premises currently under quarantine. I'm going to kind of list them out there. We've got 4 premises that are currently undergoing our disposal. And so those are the 4 most recent cases that we found in January. And once that disposal and composting part gets far enough along, then they'll do their cleaning and disinfection and environmental sampling. We are working through our BCAP audits. That's the other auditing program that USDA requires now of these infected prems. So all these infected prems have to go through a BCAP. That's the Biosecurity Compliance Auditing Program. I hope I got that right. And that's been a learning process for, I will say, all of us. Producers, have had to kind of rewrite their plans in order to be compliant with the programs. Our state auditors, we do our best to try to make sure that we're capturing all of the things. We're walking inside the barns, outside the barns. It's been helpful to learn from Wildlife Services what they're looking for, so that when we're inside the barns, we can try to identify some of those same things. So we're looking for those, gaps that are, bigger than an inch. And working with the producers to get those mitigated. So, I think those audits do kind of work together. So we've got 10 premises of those 30 that are still in that process. And we still have 3 active control areas. So if you guys remember from my last talk, I talked about what happens when you're in a control area, all of the premises that aren't infected, but now they're affected because they have to get permits, they have to be doing surveillance activities. And we're not in this alone. High path has been pretty active throughout the country this winter. So this is data that I pulled yesterday. This map up on top is all of the commercial flocks that have been affected within the last 30 days. And then the backyard flocks. And I was actually really surprised by how much green there is on that bottom map, backyard flocks. So there's a lot of AI still out there. And we like to think that it's further south of us, but we've proven ourselves wrong with that by having detections within the last couple weeks. Avian metapneumovirus, and we've kind of talked about this to death. It's still out there. It's still causing significant impacts to the industry. We do have quite a few vaccines available now to the industry. And so most flocks, from my understanding, are getting vaccinated at the hatcheries. They're able to kind of give that first initial booster, but they do require a booster on the farm in order for them to be effective. That doesn't mean that pneumovirus is going away. We're still getting a lot of reports of it, and a lot of flocks that, frankly, are experiencing kind of significant levels of mortality. We've tested a few flocks for influenza a couple times because I think the producers are actually kind of hoping that it's going to be influenza, because then you at least know what you're dealing with and kind of have a an end game. And so, I think there's still a lot to learn about how those vaccines impact the flocks, how effective, how do we make them more effective? And so that's kind of an ongoing effort within the industry. And then to get away from diseases and talk about something besides high path, I just wanted to touch on A couple programs we have. One is the authorized poultry testing agent program that is required by our board rules. That's what rule 1721-0330. It states that if anybody's collecting samples for board programs or National Poultry Improvement Plan programs, they need to be an authorized poultry testing agent. And to become an authorized poultry testing agent, you need to attend a board approved training program. You need to be able to perform satisfactory work at a field school. And what we do for all of our commercial side testing agents is they have to submit samples to us to prove to us that they know how to collect those samples for verification, kind of a quality control assurances. And so once you meet those requirements, you're authorized as an APTA for 4 years. And at that time, we'll offer reauthorizations training if you want to continue to maintain that. And we do have a couple courses coming up for our commercial testing agents. We usually offer a course twice a year. So generally February and then August or September. And again, these are, commercial turkey breeders, broiler breeders, table egg layers. It's those types of premises and people who work at those farms who take that course. We've got a course next week. We do offer this course virtually. So it's a Teams meeting. It's about 2 hours. And then we do require that sample verification side of things, just to make sure that they understand how to collect the samples, how to submit them to the lab, and how to fill out a submission form. I'll give kudos to Michael and his team for helping us to create a blood collection video. So we've kind of always tried to scavenge off of other states to kind of demonstrate and show how we collect blood. And it's never quite right. And so we created a video ourselves, which we'll be able to use now at our course next week for how to collect those samples and get them to the lab. The other course that we offer is for more of our backyard producers, and it's for pullorum typhoid testing. So this is the testing that producers need to test for to become NPIP, or for anyone bringing their poultry to a sale or an exhibition, they need to be pullorum typhoid tested. And so that is an in-person course because it does require some kind of hands-on training. The pullorum typhoid test is a plate test that's done pen side, so it's done out on the farm. So we want to make sure that those people who are being trained for that really understand that process and know what to do if they find a reactor. And then lastly, I'll just give another couple updates on the National Poultry Improvement Plan. We've got a biennial conference, so that happens by its name every 2 years. Coming up this summer, this year in Salt Lake City. And at the biennial conference, we're allowed to bring a delegate to represent each of the subparts that we have in Minnesota. And so those numbers probably don't mean anything to anybody, but 145 refers to our breeding program within the NPIP. B is table egg layers, C is broilers, D is turkeys, E is kind of our backyard Wagby flocks, and then J is our upland game birds. So we'll be looking for a delegate to come and represent Minnesota at the biennial conference. And then the 146 program is our commercial program. So it's our meat type turkeys, so our slaughter plants that participate. And that's C and D for broilers and turkeys. And then B is our table egg layers. So at the biennial conference, that's our opportunity to look at changes that are being proposed to make changes to the Florida federal regulation or program standards. So if anybody wants to submit a proposed change, anybody can do it. Those have to be submitted to the NPIP office by March 14th. They will also be looking for nominations for individuals to serve on the General Conference Committee. That's called the GCC. And this year we'll have an opening in the South Atlantic, South Central, and then West North Central. And Minnesota falls within that West North Central region. Currently, Dr. Ben Wildman with Select Genetics is serving as our GCC delegate and chair, and his term is coming to an end. So we'll be looking for nominations to represent the West North Central. And it'd be great if we can get somebody from Minnesota. I've got a couple people who have already expressed some interest, but if you know of anybody, we can throw names in hats. So, and again, those terms are expiring in August. I think nominations have to be put in by June. And then those be voted on at the biennial conference. That's what I had for poultry updates. Does anybody have any questions?
What's the status of the farm antigen this year? I mean,
I've
every.
not heard that there's any problems.
Okay.
Yeah, we've been able to obtain it. So, if you guys remember a few years back,
Last year, wasn't it?
yeah. Was it last year?
2 years.
I feel like it's been a couple years.
Yeah.
It was back ordered, right? And so we did our best to hold it because we anticipated and we managed to like barely squeak through. But since then, we've not had any issues getting it.
I've wondered if AMPV is also a wild bird problem.
Let's say,
Is anybody testing for that?
I'm not sure that it is, but I'm not in that lane either. So we at this time are not, our lab is just looking for avian influenza. So I'm not sure on our end. Well, I know at this time we're not on our end of it.
I know that question has been brought up before, and as far as I can tell, nobody has the money and the funding to do that, so.
So
Maybe
they're just
another
looking
grand
to-
challenge.
I'm just wondering about transmission.
Yeah.
I guess we just don't know.
That's the $1 million question, right?
Yeah.
So what would it take for you guys to test for avian metapneumovirus?
I'd have to talk to our lab. Like I said, it's in Fort Collins, the wildlife disease diagnostic lab, that we use out there. You saw on my slides that there's a lot of, as far as the blood work goes, there's a lot of pending stuff there. It's my understanding that we're still looking for a lab that can do blood work for us too. So I don't know what it would take. I could ask our lab and see, if that's something that they would be interested in, or if they're saving. I mean, all of our samples get saved. So there's just potential to go back in time and test.
I
So,
think too, you want more turkey producers, you gotta offer, you know, I mean.
Yes, I think Hemant would love you if you offered another source of revenue for it. It's an interesting question though, because we get the reports from DNR on wildlife that's been tested, but they're only testing for high path, and if they come back negative, we don't know what caused the death was. If that was a domestic bird, usually the follow-up test is AMPV, so it would be interesting to know.
So it's too bad Hemant isn't here, but Arno Weishman got a pretty large grant to look at wildlife testing, and I don't think it's just limited to high path. I think he's looking for other diseases too, so it might be worth a conversation. There might be a possibility to expand that.
Questions around the vaccinations for AMPV, how is that administered?
So, and I'm gonna probably get this wrong because I can't keep these straight, because there's a whole bunch of vaccines and some are live and some are killed. And so at the hatchery, it's a spray vaccine, and I'm pretty sure that's live, or like a modified live. I think it's a live vaccine that they spray on. And then there is the possibility for some injectable vaccines. And so I think some of our longer lived birds, like breeders, at least had been getting an injectable vaccine. But now there's also like the commercial producers that want to do the booster on the farm. It's a spray vaccine, and I'm pretty sure that one's a live vaccine as well. Erica, have you done it?
Yeah, I do spray. So ours gets sprayed at the hatchery, and then on my farm, I just spray them once at like 4 weeks of age.
And you're using the modified live for the second, or using the kill for the second?
Can't remember what it is because I just switched to the different strain. And I can't remember if there's a difference between A and B either. There's been some question with strain A on the efficacy of it, but also it just seems like it affects the birds more aggressively, if that's the right way to explain it. The type B also, it's been said that it may offer more, what's the word?
Protection.
Protection against A and B. Correct, yes, cross protection. If Ashley Coles is on she might remember the difference, but I can't remember because I just switched to the different strain. But anyway, producers that like heavy toms, for example, will have to booster twice on their farm just because of the age, my brain is not working today.
The immunity starts to wane a little
It
bit.
does,
so
it
then
does,
they need
and
to
so the amount of
booster.
time their life on the farm is longer than like they are on my farm. So,
But yes, there's A and B, there's live killed,
Modified.
modified live, and like 4 different companies, and I used to have a little chart to try to keep track of them. I don't know.
yeah. So, any other questions, comments, suggestions to your new mobiles? All right, thank you, Shauna.
Hang in there, everyone. I think I'm the last one, right?
You are.
That's for next. Before I get started, I want to say thank you to Ashley and Mitt over here, both from AHS, and I've been like,
Can you speak louder? The thing is.
oh, yeah, just Ashley and Liv. They both work with AHS here. I guess I'll let you introduce yourself.
I'm Ashley Kudis. I am one of our 2 humane investigations agents that we have here at Animal Humane Society. I do all the state statutory enforcement, so the dog fighting, cockfighting, bestiality, cruelty, neglect, abuse, and breeding as well too. So we work directly with law enforcement to aid them in enforcing the animal welfare chapters. It's not uncommon for a law enforcement officer to encounter only one of these cases in their entire career. So when you walk into a house with 30 cats, it can be a little alarming and they don't really kind of always know how to handle it. So we're here to kind of fill that gap. I have 13 years now of experience as far as animal welfare enforcement goes. I've been with AHS since 2018 doing the state statutory enforcement. So I'm kind of that go-to person for our law enforcement to help them with these types of cases.
Hi folks, I'm Liv Hagan. I'm the Director of Animal Welfare. I think I've probably email corresponded or talked on the phone with several of you before. I oversee our Humane Investigations Department and our Shelter Behavior Services. So I don't have quite as much knowledge as Ashley, but a good amount. I do some agent work when needed. I mostly serve as more of a coordinator role. I help bridge the gap between investigations and our operations, especially when we need to seize animals and bring them into the shelter. So I also oversee and deploy our critical response team, which is that team that we send in to handle and remove animals when that's necessary. So mostly too, if a case comes across one of you guys and you're like, oh, this isn't really me, but I think these animals need help, we'd love to hear from you. Give us a call. We'll help navigate it. We'll take the case. We'll help work with law enforcement. One of our focuses, particularly in the last couple of years, was helping both city and county attorneys really pursue charges for cruelty and neglect. Prosecutors don't like taking cases that they can't win. And as Ashley mentioned, a lot of times they see one, maybe 2 cases of cruelty and neglect in their entire career. And that can feel really scary for your win percentage.
What species you guys as an or agency cover?
Yes, great question. What species? So we're companion animals here in shelter, but we also investigate cruelty and neglect for any reported species. Livestock, we've worked exotics, yes, sort of begrudgingly because not a lot of people here have experience with exotics. But we will then work to partner with other organizations if we do need to remove, handle, anesthetize for removal. We partner with the organizations across the country. I think our last wildlife case was two or 3 years ago, and animals kind of went everywhere for that. So if we don't take it into shelter, we work with partners who work with a lot of first rescues that can help us with things that can't come here. We do avoid at all costs taking things that we don't adopt out. But we've had chickens here fairly recently. You may have heard of our large-scale pigeon case we had back in June. That is a species that we adopt out, but we had about 150. And so we did partner then with some private private owners of flocks and some rescues to get those placed, because we can place some pigeons, but not quite that.
Well, yes, they were kind enough to be here today, so if at any time, as well, for me, as I'm going through this, if I say anything that's just totally off the mark, please chime in.
Happy to help. Happy to be
Yeah,
here.
yeah, and if anyone has questions for myself or them, they will be here, so. And I think the important part is that because our role at the board is somewhat limited when it comes to welfare, that the cooperation that we have, this collaboration has been really important, and then it's been a blessing for me, just being new on the job, to just have this resource, so just thank you for that. So, but our role, so as we're going in and we're dealing with our stakeholders, our kennels, our breeders or whatnot, our job is to make sure that they're meeting the standards of care that are written into statute. So we go out there and we go through our checklist and make sure they're doing what they're supposed to do. For things that they are not meeting, that do fall under our umbrella, then we work with stakeholders to make those corrections. So if it's something simple, like whether it's record keeping or food storage, or maybe an educational warning, send us some pictures that you've taken care of it, or we'll be back in a couple of weeks, make sure that it's been addressed, those sorts of things. For more serious violations, a notice of violation with a correction order, and potentially, fines too, depending. Now, if it ever gets to that level where it's a welfare concern, that's when we will reach out, and that's when we now, as a veterinarian, by state statute, we are obligated as veterinarians to report any cases of welfare issues that we suspect, and we're protected by that law. So if, as long as we're doing it in good faith, we can't be sued for, if it turns out there wasn't the welfare issue. But not all of our field staff are veterinarians, so they're not necessarily obligated to make those reports, but we want them to. And I've told them if they're not comfortable doing that, to come to me and I'll make that report. So these are in the state of Minnesota, these are the people who can investigate welfare issues. So law enforcement, humane societies, and animal control officers. And we won't get into the weeds on the humane societies part of it, because there's some politics and stuff there. Ashley was kind of spent 15-20 minutes the other day going through that with me, and I think I got it, but I feel like she was holding back a lot. So that's fine. So these are the individuals, and as she pointed out, a lot of law enforcement, they don't have the training. You don't have the training, they don't have the time, because they've got a lot of other things they have to do, or they just don't have the desire to do it. So, so when we get a concern reported, the first thing I will do is notify. Generally speaking, my go-to has been Ashley, to be honest with you. So, because I just feel like that's something's going to happen then. So, and then after we made that notification, we will determine if it happens to be one of our stakeholders. So in this situation, I guess what I'm describing here is we'll get maybe a phone call or an email from someone who's concerned about someone who's breeding dogs, for instance, or they feel like their neighbor is, not treating their animals well, whatever it happens to be. Now, if it's a breeding situation, the first thing I will do is, or my team will do, is look in to see if they're one of our stakeholders. And if they are, then we can look at it as, how are they meeting the standards of care? So that in that situation, we can go and take a look. And so we do, we'll address that. If they're not one of our stakeholders, that's when we call in those who can look at those types of things. And if there is a welfare concern with one of our stakeholders, and I'll use the example here in a little bit, we work with them just to go in there and see if there's things that maybe they're supposed to be doing by law, that we can help perhaps add to any charges that they might be facing because of their maltreatment of animals. So the process, so we will get a formal complaint from someone, and that's what we'll do some digging then to, checking their social media, website, whatever it happens to be, see if they, first of all, they had enough animals, they've bred enough litters, if they qualify, but yet maybe aren't licensed. We'll assign someone in the field to investigate, and then we'll schedule an on-site investigation. Now, announce versus schedule, letting them know we're coming. There's obviously some pros and cons there for each of them. On an unannounced visit, you're more than likely to get a true picture of what's happening at a facility. If you call and say, hey, there were some concerns came up, can we come out next week? They're gonna do everything in their power to move animals or clean things up. And so just having that ability to show up unannounced, I think is really important for catching some of those behaviors. I guess, and then the con would be, and maybe I make more of this than some of the field staff, my concern for their safety. I don't want to send someone out into a situation where, they're out in the country and, they happen to run into an individual who just isn't fond of government entities. And I lose sleep sometimes worrying about that. So, one thing that I've taken to doing is if we know we have someone that we want to check in and we just want to stop in, right? We don't want to let them know we're coming. I've taken to notifying local law enforcement, usually it's a sheriff's office, and just say, hey, you want to check in on this place. I understand that although they do have jurisdiction over welfare concerns, they can't just show up and do an investigation and bust down the door. They may, right, they can't do that. They need a warrant to do so. So they can, however, show up and do maybe a knock and talk. So they just take a look around, ask some questions, or a civil standby. So they're just there to make sure that our field staff are safe. So, and I've made a few calls to arrange for that for field staff, and some of them have taken me up on that. They just call the sheriff's office and let them know they're on their way or going to be there at a certain time. And others are comfortable without. So, but I just want them to have that ability, that safety net if necessary. So one example, I received a call from AHS, and they were, this was just in, it was the day of the Emerging Issues Conference, I believe. The weather was beautiful that day too. They were going to exercise a warrant. So they had a warrant to go into this place and do a welfare check. And so because they knew there was breeding occurring, they actually let me know that they had this warrant and wanted to send one of our investigators with one of our field staff to see if they did indeed qualify as a commercial breeder. So it helps us and it helps them. And kudos and thank you to Brian Zemer, Mr. Johnny on the spot, dropped everything he was doing, right? Yep. And he did, right on that day, he went out there and participated in the investigation for us. And so did some animal counting. Your group did some animal counting after the fact. And so that's just one example where they had the ability to get a warrant. They invited us to play nice and tag along and to come with them. So that was really beneficial for us. And I guess I'm speaking for you. Again, if it's one more charge, if they can't get charged for animal cruelty or this, that, or the other thing, but they meet the qualifications for a commercial breeder and they don't have that license, at the very least, they can be fined. So, and my understanding is the more things that prosecutor has on their list, the more likely they're going to want to pursue something.
It's not uncommon when you're looking at criminal charges for plea deals to be made. That's very, very common in the animal welfare enforcement. So
a lot of times what we'll see is we'll see them play with what charges are they going to pursue, they're gonna drop charges if they plead guilty to this one. So really having kind of the whole layout of what are our options allows them to have more playroom. As far as Minnesota goes, in the last, I'd say 15 years, we've really seen a change in how things are being prosecuted. Whereas before, you know, it wasn't very common to get a guilty plea deal or even a guilty verdict on animal welfare stuff. But in the last 15, and it's really based because the community standards have changed in the last, you know, couple decades. So the community is calling for more enforcement, and so the prosecutors now are catching up with that. So we're starting to see more charges stick, more plea deals being made so that the appropriate sentencing can be handled out. You know, the biggest thing would be monitoring how many animals they actually have moving forward, putting them on probationary mental health treatment, you know, order mental health treatment. So really setting things up for longer term success than we've done in the past. So yeah, so having just even the extra Board of Animal Health violations for the commercial breeding factor of it is just one more thing that we get to play with when we look to, okay, what is our best option for this particular person and how do we prevent things moving forward?
Thank you. Yeah. So another example then, again, A just let us know about a concern with one of our counts that happen to be a individuals working as a town for multiple municipalities. But they also had a relationship with the local PD. And so we were able to coordinate just kind of popping in with the local police department, look around, see things. And with our initial visit there, we only had a few animals, but there were some records issues. And so you know, the plan was that Allie was going to be back out in a month to do her yearly inspection regardless. So we said, well, you got, you know, 30 days to get it straightened out, but we're not necessarily going to tell you when we're going to be here. We're just going to be here. And I believe between that and her time going out, I went out one time, just popped in again with the local PD. And again, there's only a few animals there, and it makes it fine. And Allie went out again unannounced, and it was a bit of a mess. So there were a lot of animals. There was cleaning issues. There were problems, and there was a list of problems. And at that point, then because she had some welfare concerns, it's still notified. Yeah, but that we're right, you know, 2 ugly cases at that time too. So this one has a bit of a happy ending, though, because Allie's most recent surprise inspection, I mean, 90% of the things we wanted corrected were corrected. You had new cages, you had a new cleaning protocol in place, and his veterinary visit scheduled within the next 7 to 10 days. So it worked out in this sense where the animals were getting taken care of better, and he knows that at any moment he can pop in anytime because we still have that relationship with the police officer there, and she pops in just on a random occasion too, to make sure things are still running like they should be. But also we are able to, I don't remember how many municipalities did he work with, was it 5, 6, 8? So that would have been a vacuum for them for the stray animals if they would have no one else to help them out with that. So it would allow them to continue to use the services because they're comfortable keeping them licensed, but will be kept an eye on. So I kind of touched on this, that you know, 90+% of our stakeholders, our breeders, and our kennels, they're absolutely wonderful to work with. I don't have concerns for the safety of our field staff, but it only takes that one. So, and with that is, I guess, the summary of what it comes down to. It is some of the limitations for ourselves at the board with what we can address for welfare concerns is frustrating. I won't lie. I mean, it's frustrating for them. How many in the state of Minnesota? How many welfare investigators are there? 52 or,
52 counties that I manage.
yeah. And yeah, I mean, that's a lot of stuff. And then some of them there's Minnesota Federated, correct?
Yep.
And is it one? Do they have one?
I'm not quite sure where they're at right now. Yeah, not totally sure what federated staffing looks like. We are not associated with federated and we do not work cases with federated.
Yeah, yeah. So, but the point is not enough, really. And so, and just the amount of training that's necessary. Again, law enforcement has plenty of other things that they would rather be doing. So it would be nice if some changes were made to statute and to law to, I don't know, a dedicated group of individuals that enforce animal welfare laws, you know, the right law perhaps would be a good thing. So with that, I guess I will just shut up and see if anyone has any questions. Thank you.
Any questions?
Just one point. So historically, we get criticized at the Board of Animal Health because we're not inspecting someone who they see on Facebook or somewhere else is running a breeding facility and we did nothing about it. So we can't do anything if we don't know. You know, there's always that issue, and it helps to have partnership where we get the opportunity to inspect and enforce. But that I would say overwhelmingly, that's the complaint we get. Why aren't you doing something? Why are they allowed to? And it's like everything. It's the people that are trying to follow the rules that we have contact with because we have the information. The ones who are flying under the radar. So having more information and the ability to get in and do the inspections we have the jurisdiction to do is the important missing piece. So.
Right, yeah. And we frequently get complaints, you know, where it's not necessarily a breeder name, you know, the list on the website has the breeder name listed out. So, you know, I constantly, it's actually a favorites tab. So I'm always looking at that to see. But it's very frequent that I will reach out in an email and say, hey, I have this address and this person name, and I've got a complaint that they are breeding animals. Are they on your list? So that is a very frequent thing, like multiple times a month probably, just to say, hey, is this something where you need to be looped in? And if so, I'll send the RP over to you to start that process. If not, okay, I'll start my process, see what I have. I'll get out there. If there's no animal welfare violations at that time, they might be in the breeding violation. So I take that opportunity to say, hey, look, these are our state laws. This is what's required of you. This is the process. You need to start that within, you know, usually I give them like a week or two to start that process. And then I reach out and say, hey, I've got this. This is what I've seen. This is where they're at. Let me know if they don't follow through. And then we just kind of would work hand in hand to try and resolve that issue moving forward. But it really allows a really great communication tool between us. Since you've started working, we've emailed back so many times about cases. So it makes my job a lot easier as well, because I know kind of what I'm walking into, and when I walk into it, who do I need to call and who can I reach out to?
Yeah, for sure. Yeah. And I will say, we get tons of complaints and calls of things that we have zero jurisdiction over, and they're not necessarily welfare complaints, like, well, you know, someone bought a dog from a breeder and it has hip dysplasia or something of that nature, right? And so those are things that are not really welfare concerns or complaints, and they don't really fall underneath our jurisdiction. They don't fall underneath really, other than commerce, I suppose, with the headline of that. So yeah.
How often do you get a complaint about somebody breeding and they don't know that they have to be licensed with the state if they're a breeder? I mean, how often does that happen?
9 times out of 10, they'll tell me. They don't know. So, yes, it's very, very often they claim they didn't know. But after I leave there, they are very well informed as what's required of them. And so they cannot use that excuse anymore. And I'd be sure to put that in my report so that I can share that, obviously, with the board.
Yeah, it's amazing at how many, I think 10 is the number. I never remember the number. You have 10 breeding animals. It's amazing how many people have 9 breeding animals.
Just right under the.
It's almost like you know, they read something somewhere or something. Yeah.
Yeah, and kind of to go back to that recent breeder case that had worked recently. That one, of course, claimed that they didn't know that there was a commercial breeding license or law that she had to adhere to, but she only had, was it 6 breeding adults that she would breed, and she'd only produce a couple litters a year. Well, knowing when we were in this house, we removed up to 30 dogs and they were all free ranging. So there was likely going to be unwanted litters that she clearly fell within the required categories because she was advertising puppies. She was selling them on Facebook. She was doing all of these things that would know that she's breeding, that she knows that she's breeding. And so we were able to go back and look at the total number of intact animals and then the pregnancies that we found actually here in shelter while they were on our homes. And then we submitted that to the law enforcement, and then we got a wonderful letter from the board to be able to submit to them as well, so that they can utilize our evidence that we found during our forensic evaluations here at shelter on top of my evidence that I saw in home, and then the letter as well to be able to utilize the Board of Animal Health statutes to pursue that charge.
Thanks for the letter, Andrew. Is there anything?
Any other questions?
Keep doing what you're doing.
Every day.
Thank you both for being here.
Yeah, no,
Appreciate it.
pleasure. Our pleasure. And yeah, if you ever have any questions, definitely feel free to reach out. If you want my card, I'll leave a few on the table here, so feel free to grab one. But even if you have just a really random question, more than happy to have you run it past me.
I'll give her one of the line case. We just need more vets, especially livestock.
There you go.
Let me know. I'll leave some cards.
Yeah, thank you.
Yeah, thank you. So welcome. You guys have a great day.
Oh, very nice.
That brings a tour.
Yes, so we have our next meeting set for April 1st, looks like at the U of M St. Paul campus. Would we like to set the date for our September meeting? Well, I won't be attending, but the rest of you can decide on it.
How about those guys? I don't know.
Dr. Fox and Steve, do you have any suggestions for a September date?
I am gone the whole first week, so that week would not be ideal.
Yeah, I don't want to do it the first week either. The middle of the second week would be just great.
Have it in your, probably right. But there-
What's the going?
We'll have a show problem.
Oh, shit's coming.
Yeah, it's something okay.
I just had it on the calendar.
September.
The
A
16th,
couple days we're gonna have
16th would be the next,
State fair, so definitely not the second.
16th would be next week after the 9th. That
Well,
is,
the night did not work, you said?
I think it's Wednesday, it's all day Thursday. Yeah.
This is 16.
Yeah, I think we're gonna need
The 16th, 16th? Dr. Fox and Steve, the group here is saying September 16th. 1-6.
Okay.
That's good for me.
Right. September 16th, it is. Is there a motion to adjourn the meeting?
I saw move.
There's a motion, is there a second?
second,
Any discussion? All in favor, say aye.
Aye.
Opposed, say so. All right, motion carried. The meeting is adjourned.
I wanted to, now that the meeting is over, I probably should have done this before. I want to thank you for being representative. I know you'll probably be here in April, but there is a chance that if there's so much going on, they're gonna get somebody in your place before that. So, I wanna thank Vicki for everything she's. Thank you. You can get it.
Thank you.